Welcome to the March 2nd, 2021 first of our work sessions on the Arlington County budget. The board is here, all members, the manager is with us, and we are set to have several presentations today from our public safety, including the fire department, the sheriff's office, public safety and communications and emergency management, and our police department. Thank you to everyone who's joining us virtually or by live stream or cable broadcast. I just want to remind everyone that these presentations are available online as is the entire budget document that has been proposed by our manager at budget.arlingtonva.us. Before we get started with our fire department, just wanted to share with public safety listening in, our public safety leadership listening in, and with colleagues, perhaps this year as much as any, government's responsibility for the health and safety of our residents is particularly powerful. So we can't take it for granted, and we're working hard on COVID with respect to our health. So with that, I will send it over to the manager. I believe we're going to start with our fire department.
Yeah, thank you. Thank you, Mr. Chairman. And as you noted, we're starting our work sessions today for the fiscal 22 budget. And as I said when I presented the budget a week and a half ago or 2 weeks ago, this budget tries to transition us from the current pandemic we're in to a place where hopefully we'll be on more firm footing for fiscal 23. And so that bridge that we take, I know there's been a lot of conversations over the last year about public safety, and it's permeated a lot of our national consciousness. And I'd like to state just at the outset, we really remain fortunate in Arlington to have a highly trained and effective public safety team. And you're going to get to hear from each of the members of that team. While not perfect, I think they do a great job at keeping us safe and secure. So, a lot of conversations about the pandemic. I think that we'll focus on that to a certain degree, but I also welcome your focus on what really struck me this year in going through to prepare for this is in each of the departments we're going to see today, there's seeds that were planted many years ago, and we're starting to reap some of those benefits. You'll hear a little bit about it from the fire department on the emergency triage, treat, and transport. You'll hear about it from our emergency management staff about remote call taking, and also police with some of the things that they do on homelessness services. So there's a lot of, I think, very exciting things going on. With that, I'm going to turn it over to Chief Pavlitz, who I'm going to ask to introduce any of the staff he has with him and then start to walk through the presentation. Chief Pavlitz.
Thank you, Mr. Manager. Mr. Chair, on behalf of the Public Safety Chiefs and Directors, thanks for your introductory comments, and members of the board. We appreciate your consideration of the direction of the fire department in 2022. I'm going to bring up the presentation. Okay. With us online this afternoon, we have Assistant Chief Joe Rochetter, Medical Director Dr. Reed Smith, and Fiscal Officer Casey Bailey, and I'll be glad to provide additional information and also answer any questions. So just as all of our public safety departments in the county and also the regional departments, we share the challenges of the pandemic, also from election to inauguration threats, and then also the fiscal strain that's happened accordingly. To safely serve our communities and protect each other, we had to become very smart, very creative, adaptable, and disciplined. And I'm very proud of the 370 firefighters, medics, officers, chief officers, and staff who really rose into the occasion in 2019 through 2020. And also we're poised to have, we'll persevere through 2021 and looking forward to 2022. So our core functions are obviously emergency response and trying to prevent those emergencies through prevention and code compliance. We had to become very creative with community outreach and education during the pandemic conditions, but we're slowly starting to increase some of those outreach and also some of those contacts. And we also always maintain focus on being a regional partner within Northern Virginia and the National Capital Region. And we work well with all of our satellite and neighboring departments through information exchange, and also through sharing several initiatives. So comparison of 2020 to 2019, what we saw in 2020, we ran 3,500 less calls, primarily due to pandemic and less mobility and less circulation. But each one of those calls became an incident inside of an incident. So whether it was an emergency medical incident, a fire, or someone trapped in a vehicle, we had to protect the patients, the occupants, and then also protect ourselves and each other. And it just took additional time from decontamination, patient transfer, making sure we're personally clean and also the stations. And then as we leave and go return to our families, make sure we did not spread or contaminate any of our loved ones or friends. So that's constant. And we refined that process from the start, from where we learned at the beginning of the pandemic through where we are now. We have many innovative and insightful practices which we share with our partners, and a lot of the things that are occurring in public safety, at least fire rescue and EMS within the region, we had a startup. We pretty much shared that information, and it was to the benefit of the region. And the last point, accreditation. We're in about a midway point of our 3-year accreditation process. We've been collecting a lot of data, looking inside the department, also in the community, and that's going to feed probably some of our future fiscal year requests in terms of personnel, staffing, units, and also stations. And I'll talk about that a little later in the program. So we anticipate somewhere between probably midpoint of calendar year 2023, where we go in front of the accreditation committee, and then hopefully we bring some good news back to you and to the community. Some of our fiscal year 22 highlights. One of the core tenets of the next fiscal year is going to be Et3. It's a federal program, it's a pilot program, which Dr. Smith will be talking about in about 2 or 3 slides. But it focuses on bringing telemedicine, connecting to members of the community where they live or where they are, alternative means of transport. Instead of routinely transporting to an emergency department, we may be going to other care facilities in the community, and also treatment in place, trying to close down the gap between the emergency department or medical providers, and again, bringing these points of care closer to the individuals who call for them. And there's lots of benefits that Dr. Smith will be elaborating on. And as the manager said, one of the initiatives that was born maybe 4 years ago and supported by the board was a reduction of work week program. And I'll profile that in about a slide or two. But we're so close getting ready to turn it on. We appreciate all the support, but I'll step through how that's evolved and what it's going to look like when we actually implement it here with your approval. We're always looking to make sure we have equitable and effective coverage, and that does go back to accreditation. We constantly look to make sure we have the right personnel, riding the right units in the right stations in the right place to quickly serve and also effectively provide emergency services and response for the community. And then constant, even though we've had to change this during the pandemic, but we're starting to get more in-person contacts through safe practices. We went virtual, but now we're getting ready to return into many facilities, prevention through inspection and code compliance. So all of our building system inspectors and fire marshals, even though we've seen a little bit of less activity in the commercial sector, we still need to make sure these structures, these occupancies are code compliant, safe, and everything is in its proper state. And that just enhances our response. We have to use some of these systems. Okay. So what we've come through with through the pandemic, we've learned a lot. We are still learning and evolving and changing as we get more information from specialists and doctors and physicians. We've had a great relationship with the public health division. They were with us from the start, and they've been very conservative and very protective of us to make sure we're safe, we're secure, and same thing with our family and friends after we leave our shifts. So the medical calls still kept coming. And actually, we saw a little bit of a dip, but now we're back to regular annual levels. We see a fair amount of cyclical nature in sick people, but we have to take them safely, meet them where they are, and also bring them to the hospital. And we've had a very good partnership with Virginia Hospital Center and our surrounding hospitals to protect their staff and develop new ways to make sure we have effective patient transfers, and also to return to service quick, clean, and make sure we protect the next patient we are dispatched to. We've had a focus on our health, wellness, and safety programs. We instituted a 24-hour safety officer. That was also stemming from the pandemic. We had a lot of interaction with infection control internally. We had to make sure we had the right practices, procedures, and also ways to have personnel return safely to work. Unfortunately, we had lots of our family members and lots of us were affected in various ways throughout the pandemic, and we're still seeing that right now. I'm happy to say we are on day 5 or day 6 of 0 quarantine and 0 isolations, and that's where we want to be. Everyone seems to be healthy, and we want to keep these good trends, even though we expect some fluctuations in terms of some of the pandemic parameters. Again, we've also been partnering with the Public Health Division and DHS. If they need assistance in terms of any of the either testing clinics or vaccination centers, we'll provide staff, we'll provide support. They tell us where to go, tell us what we need to do, and we are there. And we continue to that relationship now and hopefully into the future, crossing into 2022. With that, again, while we're operating in these pandemic conditions, this goes back to innovation. I would like to ask Dr. Smith to come online and talk about 2 really interesting initiatives that to credit him and also Virginia Hospital Center, our blood products program, and also where Virginia Hospital Center is going in terms of a trauma center. Dr. Smith. Dr. Smith, mute.
I need that mug that says you're on mute. I appreciate the opportunity to address you all, and it's always a pleasure, although I much prefer to be in person in the courthouse. I enjoy sitting in the courthouse room. So blood products. So we, along with Loudoun County Fire Department and Northern Virginia EMS region, became the 2nd region in the United States to field whole blood in our medic units. So Arlington County, along with Loudoun County Fire, now carries whole blood. So we carry units of blood in our supervisor vehicles for rapid administration and transfusion of people in the field. In our kind of 6 months, we've done 4 units so far with really good outcomes and no complications. So it's very innovative. I think we're one of 10 agencies or 12 agencies in the United States that are actually fielding whole blood, and certainly the 2nd region in the United States that are doing it. VHC as well, and we help to support VHC in their move towards a level 2 trauma center. If you haven't heard, last week last week they got their final certification and recommended. So it's gone to the state now, and hopefully in the next kind of 4 weeks or 5 weeks, they'll actually get certified as a level 2 trauma center, which completely changes our operations and makes it, they will be our primary trauma center at that point for our region. So both very, very good programs.
Great. Thank you, Dr. Smith. All right. I'd like to talk about our next initiative requested in FY22 is to finalize a reduction of work week initiatives. So started, I think, in FY19, the board considered and approved incrementally hiring personnel over a 4-year period to reduce the hour of our shift workers, which we have about 78 on minimum staffing of 78 on shift now, bring them down from working 56 hours a week down to 50 hours a week. The graphic's a little tight and compact, but what does that mean with our 24 on, 24 off, 24 on, 24 off, 24 on, then 4 days off schedule played out in the little calendar graphic in the middle? That amounts to that particular shift works 10 shifts per 28-day cycle. This inserts what's called a Kelly day, which is 24 hours off. It's just basically like a regular Saturday or Sunday. Off roster, don't have to work. That gives more time for personal work-life balance. That gives less hazard exposure. That's just less time you have to be in emergency conditions, being exposed to carcinogens, and also the stress with dealing with emergency response. That also could go to improving attendance. It's a good recruitment tool, as a lot of our competitors, some are instituting this, but for the most part in Northern Virginia and National Capital Region, we're going to be working at a very favorable schedule at 50 hours a week. And there's just a lot of benefits, and we're so close with this next fiscal year of onboarding 10 personnel. Sometime in January, we'll be able to implement this. And we appreciate the commitment. We appreciate all the support over the many years. And if there is momentum, we'd like to keep this moving forward. But right now, we wanted to say thank you very much, because this has been a long time coming, and it's going to be very well received from all personnel working in the fire departments. To that end, again, can't say enough. Thank you very much. And next, I'm going to bring Dr. Smith back to talk about ET3. a fantastic pilot program. We're very excited. There's a couple stages of this, but this is kind of where the Emergency Medical Services needs to evolve. And there's so many benefits. He's been a great champion for it, and I'll let him take it away from here. Dr. Smith.
Thanks, Chief. So for the background, if people just to kind of cliff notes on ET3, ET3 is a federal billing program that allows us to bill CMS, to bill Medicare and for Medicare beneficiaries that are providing alternative treatments to just right now. All we can do is take them to the hospital. So there's no alternatives, and so there are both financial and non-financial benefits. And I mean, the financial benefits of ET3, essentially, we've been doing a lot of the ET3 interventions, such as treatment in place and alternative transportation, since 2012. I think I presented to the board in 2012 or 13 about our kind of evolution of EMS and other things. And we've evolved all of that, but that was at a financial cost to a certain percent because we're unable to bill CMS for the services because CMS did not approve that billing. They now have a pilot program where one of, I think there's roughly 250 or 260 agencies in the United States that were applied for and accepted into this billing program that for the next 5 years we'll be able to bill for services that we are able to provide. So we're recouping costs that we've been losing. And I wouldn't say we've lost them because we've made them up on other things such as efficiency and other areas, but we were actually going to be able to bill now, which is good. But really the financial benefits of ET3 are not what I think is fantastic. What I think about ET3 is that it is really, when you look at it, it is an equity and it's an equity program. It allows us to bring innovative medical care to the underserved, some of the underserved citizens in Arlington County. We will be able, not all 911 calls need an emergency care. Not all 911 calls need to go to the hospital. Yet the only thing that we have been able to offer them under Medicare services is a ride to the hospital. There are people who don't have insurance that are afraid to go to the hospital because of the expense. There are people who don't speak English and they don't know how to get a primary care doctor. They don't know how to access the medical system, and they turn to 911. Well, we are now going to be able to come in and bring alternatives to them. We're going to actually bring a physician into their house, either by telemedicine or in person. Qualified health practitioners are so it's no longer, our alternatives are sign a refusal that you don't want our care or get in the back of the ambulance and go to the hospital. We're now going to bring this to people. So it really is alternative treatment that increases the medical infrastructure and allows for some really quality things for some of the underserved population in Arlington County. We're also working with Virginia Hospital Center Physician Group to arrange for follow-up out of these visits and things like that. So, and ultimately what it is, it's truly an efficient way to appropriately resource emergency services for the community that allows us to really benefit across the board without a financial penalty and really what's best for our citizens. So I'm super excited about the fact that this is the future of EMS. It's, it's bringing equity, it's bringing innovation into medical care in Arlington County. It's crossing barriers that we have currently that we've had no way around. And, and super, super excited about this.
Great. I'm sure the chief will have thoughts, and I suspect we may have questions, but for now, it's good to hear both of your enthusiasm for this. Thank you. Maybe we'll hold the questions till the end, if that's all right, Dr. Smith, as well as Chief, but I'm interested in this, and this does seem a great way to provide care. Thank you.
Yes, sir. And thank you, Dr. Smith. Well, yes, we're very excited about ET3. Definitely proud of what we term REI, Racial Equity Initiative within the fire department. We started forming it before the pandemic, took a slight pause, and then we really started to resume in the summer of 2020. Kind of got a little bit of a kickoff. We've included about 30 members within the department and also within the community, and we've divided it into a three-prong approach, focusing on equity with our emergency service and prevention service delivery in the community. Then the middle tenet is going to be our own operations and administration in terms of policy and practice. And then the third is going to be has been our anti-racism initiative. We've had some community members, some academics, and some from the faith-based community who just kind of coalesced and they kind of adopted us. They really kind of care about the fire department and how we interact with the community and also how we interact between each other. And we have momentum. We've had a lot of anti-racism formative conversations in the fire stations. I believe we're almost done all shifts in fire stations. We have had interactive, focused connections with the community, and we're trying to line up a survey instrument through county communications. And then we are looking at all of our policies and procedures through an equity lens or a racial scorecard. And that is going to bring us where we need to be. We've made some great ground. We took a warm-up lap. We're just out of the blocks, and we have several more laps to go. This is a multi-year initiative. I believe it's sustainable. It's a combination of homegrown and the community. And outside of a little bit of push, a little bit of formation, there's really, each one of the groups have just kind of catch their own stride, and they are running. So I'm really proud of that. A lot of hard work, and it's going to bring benefits in the future. We're really excited to see where this goes and where this grows. We've also, there's a Northern Virginia, it's called Women in Fire group, and we're going to have our own local instance. We've just have a little bit of a work group and a committee forming up right now. So we're going to bring that, the gender needs in terms of policy and practice, and we're going to be addressing that. This kind of serves as a little bit of framework, but we are very fortunate to have Deputy Chief Tiffany Wesley, who is one of the co-chairs in the GARE initiative in the county. And she's just been an absolute excellent resource for us in keeping us on a very good path. Okay, some of the FY22 parameters, fiscal parameters. For a quick summary of the budget, encapsulating some of the things we just talked about. Overall, the changes are, in terms of expenses of revenue, are relatively minimal. We appreciate trying to at least move through these challenging fiscal times. We seem to be in a pretty good place, but we'll definitely detail on some of these issues or some of these points on the next several slides. So the biggest part is going to be implementation of the Kelly Day reduction of work week. Again, we plan to turn this in January 2022. That does incorporate 10 full-time employees and costs, which are, I think, detailed in the next slide, costs for having that recruit academy class moved up and accelerated, just so we have the right amount of personnel to institute Kelly Days. There is a potential impact for Et3. While it's kind of a staggered phase-in program, I think we're going to be able to implement it on the front side of fiscal 22. Very conservative estimate ranges of revenue could range between $340,000. When the program's mature, probably in a year or two, it could range in the across $1 million of additional revenue on top of our regular medical and ambulance billing services. So that's kind of an add, but as we turn each one of these components on and have the ability to bill for that through Medicare, we should be seeing some of these promising returns soon. And that should cover the expected, some of the expenses, which we estimate somewhere around $270,000. So kind of building on some of the changes, and we appreciate this, I think it was about 2 months ago, the board adopted the local fire prevention code. That takes place every about 2 or so years. And with that, there was a slight adjustment in permit and also hourly fee services. That brings us in line to all of our neighboring fire departments. So I think we have comparability between jurisdictions. So with that fee increase, expected $112,000 increase for FY22 revenues. Kelly Day implementation, like discussed before, in terms of 10 full-time employees, $1.2 million, and then increase the second recruit class to make sure we have the right amount of personnel, which should bring us up to about 370 uniform responders. That is about $1.5 million. So details of some of the service reductions. We've had one of our fiscal office staff that has been vacant. We're going to continue that position vacant in the future. We'll just consolidate the roles and responsibilities, which focus more on grant management. We'll distribute that between 2 others in our fiscal office, but we expect we get into better fiscal times. We would definitely request for replacement of that position. Another cost saving within the administrative side, we'll keep 6-month administrative assistant for vacant We won't be filling that position. We'll telework, and we've pretty much been able to self-serve a lot of the administrative support staff. So I don't think we're going to lose much in terms of efficiency there. So that's modest savings again for FY22. And then I believe the last reduction, trying to return as much personnel as possible into emergency services, those that work into the field. That's initiative for bringing one uniform member from administrative staff, returning that position into the field, and then one uniform personnel from our logistics, returning them into the field. They're available to support staffing and also offset overtime. So there's some savings, approximately $260,000 in savings as we return those members into the field and reduce overtime costs. And to kind of sum this up, key points for our FY22, and then we'll gladly entertain any questions. Going back to the reduction of work week initiative, we want to work less to work longer. It's very expensive if we have a responder, an officer, a firefighter, a medic who gets injured, who gets sick, who gets ill from an occupational issue. That is very costly to them, obviously, in terms of their health. A lot of the medical costs that are assumed also by the county, and also just backfill. So every time someone is removed from the roster, we want to try to return them back to service as soon as possible. So we're trying to reduce some of those hazard exposures through the reduction of work week program. We hope to see long-term benefit in terms of a healthy workforce and allowing them to work much, much longer into their careers. With accreditation, we want to make sure we match community growth, and we do it smart and do it wise. So we're looking and partnering with Department of Environmental Services and also Planning and Housing to see what the community is going to look like. We do have certain areas within the county targeted for an increase in population, which all of our emergency services are correlated with population density. So we're looking at some portions along east end of Columbia Pike, west end of Columbia Pike. We're turning our focus to west end of Columbia Pike. We definitely see a future need there. We're also watching what's going to happen within the national landing region as that builds up, and see if we can position resources quickly early and make some of these long-term capital and operating expenses, and just to try to inform you as we get closer to some of these points. I kind of think mid-decade, we're probably going to start seeing it. We're going to start feeling more emergency service responses. We're probably going to have to get ready in a posture to address and to also respond to those. And I think this is kind of a theme for 2020 and 2022 and moving forward. We want to try to effectively use technology. We do have some great partnerships with DES and internet service providers. We've been in front of the board talking about innovation zones. And also we have some projects as far as responder localization, partnering with DES and also some of the developers in national landing to prove some of these future technologies that will improve responder safety, improve fast, quick, smart city, smart building, and smart technology emergency services to the occupants of some of our growing and developing areas. So that's a lot of exciting things we're going to be pursuing, and also looking at the opportunity to provide or to request grant funding within the National Capital Region or Northern Virginia region. As always, we have a great, effective working relationship with all our public safety partners, all the chiefs and directors on this call. We constantly communicate, but if we can start doing something new, something innovative in terms of providing or being a vehicle to provide additional community support in terms of non-emergency health, we're starting to have some of these preliminary conversations with the police department, with Department of Human Services. So there's lots of opportunities we can identify moving forward, but we're going to keep those conversations going and also take direction from you and the community to kind of see where we need to start deploying our resources. So with that, I can end the presentation and glad to answer any questions, or we can go back to any particular slide or point of interest.
Thank you, Chief Poblitz. We'll go to colleagues in just a second. I wondered if, Mr. Manager, you wanted to provide context a little bit on Et3, if you could.
Yes, so a point which I'm sure you'll all completely understand because you've read the budget from beginning to end, all 950 pages. The Et3 proposal was not part of the document we put together. It literally came together as we were going to print, such as it is. And this was an example of something Dr. Smith talked about. We've been working on for like 9 years, and it's a happy circumstance. If the board is interested in doing something that essentially improves equity, healthcare, and revenue, I don't know if that interests you, You will have to advertise that. I would propose you advertise that at the March meeting so that we can implement that program and fee schedule and have it adopted as part of the April budget. So a little bit of a technical issue, but I just wanted to make sure you knew that. Thank you.
Thank you, Mr. Manager. Great. So colleagues, questions? Happy to start with Ms. Garvey.
Thank you. I had two, so I guess I'll start out with one and then we'll kind of go around. And the one was just the savings. It's on slide 11 about, oh, by the way, first I should just thank everybody and say how excited I am about the ET3, because we have been talking about that for a long. I mean, there's some exciting stuff. I'm really actually very pleased at what's here. But getting to nitpicking that budget detail, on slide 11, the one operational, it says operational efficiency will be reduced and there'll be reduced capacity to apply for grants. So this is one where I wonder, I just want to explain a little bit how this isn't penny wise and pound foolish, because if this particular position might bring in grants of 115,000 or more, and we lose those, then we're actually not gaining anything in cutting this position. Does that make sense? Did I express that question clearly? I'm sorry, I may not have.
Yes, ma'am. No, it does. We're managing right now. We have eyes. I think we have 4 grants in some form of either application or just waiting for some returns. I think we're going to be okay. We're going to request for additional support in the future, but I don't think we're at a threat to losing grants. Once, applications are workable, it's managing the grants and the reporting requirements. And within the ET3 program, one of the expenses is to have a ET3 program data manager. The information that has to flow back to Center for Medicaid Services is huge. That's part of this request, so that will probably be covered. But the other variety of grants that we apply for, again, I don't think it's overwhelming. I think we'll be able to manage. Yes, ma'am.
Thank you. That's very helpful. Thank you. I'll yield the floor.
Sure, we'll come back to you. Thanks, Ms. Garvey. I think Mr. Dorsey was next.
Thank you, Mr. Chair, and thank you, Chief Pavlitz. It's really I'd like to take this opportunity to really commend you and the department. The ability to perform the services that you do in the COVID era, where you have to be mindful of protecting the safety of your folks, the people that you're responding to, and still be judged by speed, heck of a job. And so I just really appreciate it. The question is really about the advancements in telehealth, which sound really exciting. But I'm wondering, because it's our job to worry, does this sort of create the need to build up policies and bureaucracies around cybersecurity and records retention? I imagine as people are performing more advanced and novel services as first responders, do they have a responsibility to create medical records that are part of a larger system in their continuum of care? Do we have all kinds of cyber threats that we need to be worried about?
The answer to that is yes, sir, and I'm going to let Dr. Smith expand on that, please.
Thank you.
Yeah, it's a great question, Mr. Dorsey. The answer is we're already doing it. The requirements for so the telehealth interface where you got my beautiful face in your living room, right, on an iPad, is secure communication, and so it meets the government's requirement for secure communications, HIPAA requirements, and things along those lines. So the regulation around the security that is not recorded or kept in any way. So there's no kind of infrastructure around that other than making the call. It's like a FaceTime call. Other than making the call, there's nothing else we need. The record, we will expand our records, because when I come telehealth into your house to provide treatment for you, I will have to have, according to CMS, and this is the law, I have to have a medical record, a physician record. We have an EMS record already. And so all we're doing is building on that record system to create 2 records for one incident, one EMS record and one kind of what we call qualified health practitioner record. But the data requirements on security and HIPAA and accessibility, all that stuff is the same as it is for EMS records. So it doesn't require anything new.
Thank you so much.
Thank you, Mr. Dorsey. I think Mr. Carantonis, then Ms. Crystal.
Thank you, Mr. Chair, and thank you for all this. I'm also very, very happy to see that we are at the end of the way on the Kelly Day, right? So we finally are right there. That's great to see. All in all, thank you for all the service that you've provided, and I wanted to start exactly there. So in the budget document, you estimate that the fire incident responses will be about 6,600 in, I mean, this is the base of assumption for next year, though in the previous year, it was always above that number. So last year it was almost 7,000, etc. So why are we estimating that we will have less incidents in the fiscal year 2022?
So you're talking about annual responses?
Yes, the number of responses.
I probably have to go back and look at that document. Our annual responses are approximately 29,000 for fire, rescue, and EMS incidents. That's what we were dispatched for. You say there's 6,000 up.
I mean, that's okay. This is page 379. Maybe I'm not reading that well. So I was just wondering because, it has been always around 7,000. So for some reason, we estimate that next year we'll have a little bit less in fire incident responses.
Oh, in fire incident responses.
Yeah.
Thank you for projecting fire incident responses. Yes.
I don't even know if this has a real budget impact.
From fire incident responses, we want to try to drive that number down. We hope to see less and less fire incident responses due to inspection, code enforcement.
Mm-hmm.
That's where we want to be. So if we can decelerate that, that's exactly our goal. We did see a much lower total responses in the start of, fiscal year 2020, continuing from the pandemic. But in the quarter 3, quarter 4 of FY21, FY21, our current fiscal year, we're back to regular numbers. It's just more mobility. So as far as focusing on fire incidents, yes, either through residential engagement and education programs or commercial inspection and code enforcement, we want to bring that down. I'm not sure it's going to have a large fiscal impact.
One option for you, Mr. Karantonis, we can follow up with this. We do a set of questions that we can route to Chief Pavlitz if that will work for you.
Oh, absolutely. Yeah, I just wanted to know because, over the last 3 years, it was kind of constantly high. And I always know that you are doing your very best in fire inspections and everything. So in prevention, basically. And, I want to be as optimistic as you and get down. So that's absolutely clear.
Yes, sir.
Thank you, Mr. Karantonis. Ms. Crystal.
Thank you very much, Mr. Chair. And I'll echo my colleagues' thanks for the extraordinary work that the department has pulled off over the last 12 months. I think Mr. Dorsey described well the almost unmeetable expectations that you've nevertheless met. And I'll add as well, and on top of which all of our fire department workers then go back to a congregate setting at their workplaces where they're living and sharing meals. And I know that's actually been a source of challenge too, as folks have had to quarantine because of exposure not only on the job, but in the community, which, then translates to on the job. So just really extraordinary work under circumstances I very much hope won't be replicated throughout the year ahead, and we thank you. Wanted to ask a little bit about the Kelly Day. So like my colleagues, I'm thrilled that we're here. It's been a multi-year journey, and to know that is going to be in effect by Q3 of this year. Obviously we care a lot about the preventing burnout and mental health strain and all of the other sort of quality of job and safety issues that the Kelly Day addresses. We've also in recent years had something of a fiscal interests in it as well, because what we're really hoping is that the Kelly Day will allow us to be more competitive in recruitment and in retention, and therefore see if we can't lower some of the overtime cost. So, obviously, I know you don't have a crystal ball here, but I'd be interested in any thoughts you might have about how the implementation of the Kelly Day in Q3 and the work week that my understanding is sort of better matches or is better in par with our regional competitors might affect the department's ability to recruit new employees and fill vacancies, as well as to retain staff as the end of the year approaches or after that milestone is reached.
I think it's going to be a benefit in terms of recruitment and retention. What we believe Loudoun County Fire is also, they're going to move down to a 48-hour work week using Kelly Days. I believe they're implementing it in March, April, but that should be it for Northern Virginia. Montgomery County has been using it for many, many, many years, but that does kind of bring us into, I'm going to say, selective company. And yes, we do use it on recruitment. We try to use that as an enticement, and it's a benefit. It's a huge benefit, huge investment, huge benefit, and I believe it's going to pay off in times. Again, I've said it before, trying to keep personnel healthy, maintaining their wellness, that this is going to be a large part of that. So we think this is going to pay off in other benefits throughout the years in terms of just being able to work, readiness to work, and just being overall in a better fitness state. I think this is going to extend careers. We started now, we're probably going to see difficult to quantify benefits in 10 and 20 and 30 years, especially with this new generation, which is coming on.
Thank you. That's really helpful. So definitely we'll realize some benefits, but it sounds like maybe the sort of retention benefits especially will be realized much later down the line, whether it's retirements a little later or so forth. We may not be seeing you this time next year planning for fiscal 23 with huge impacts, but they'll snowball one another over the years. All right. Thank you very much.
Thank you.
Thank you, Ms. Crystal. Ms. Scarvey.
Yeah, thank you. And I'll just tag on a little bit to Ms. Crystal's, what we were last talking about, which I assume, Chief Provost, you're going to be keeping track of the data. And I assume this will show up maybe in overtime. You'll have fewer people getting sick and needing to stay home and all of that. So hopefully it won't take 30 years to see it, but may play out that long. So I think this is great, keeping people healthy. And in fact, I think that will probably allow increase our ability to attract good employees. So that's all. It's great. Yeah, it really is nice to see some of these things we've been working on for years finally kind of come together. Yeah. And then back to, I just was kind of curious a little bit more. The ET3 sounds great. And Dr. Smith, when he was talking, alluded to a couple of things that are going to change. One, the carrying of the whole blood. So I'm just kind of curious or interested. Why has that not been done before? Why is that? I can get why that's better for people. It's interesting that we're one of the few to do that. That's kind of interesting. And then maybe also while you're talking about that, the change that VHC going to being a level trauma 2 center, what that will mean for us as well.
Dr. Smith.
Ms. Garvey, great questions. So number one, carrying whole blood there's a couple things there. Number one is other EMS systems don't have me as the medical director. No, but really what it is, it's logistically hard, or it was thought to be logistically hard. And, Machiavelli in the 1500s said that change is the hardest thing that we do. The cultural inertia is a hard thing to overcome. And it's never been done before. And so therefore people thought it couldn't be done. And, there's some people who pioneered this. The evidence is really good about the use of blood. And it's not just, it's whole blood. So it's blood that has not been split into its parts.
Yes, not the plasma. Yeah,
exactly. And there's really good evidence coming out. We've learned a lot in 20 years of war, in the Middle East. And some of those lessons were learned, with American spilled blood. Let's not lose those lessons. And so I was one of a group that has looked at this issue and pushed it forward. And really, it was trying to get the blood banks to understand that we have the capacity, the logistics, the training, and the scope of practice to be able to do this. And so people think it's expensive. It really, the entire program cost us, really to implement the program across the county has cost us less than $3,000. And it's not expensive. I just got off another call where I was teaching about whole blood to other EMS agencies. It's not expensive. It's not hard to do. It just took people who who understood the status quo was not enough. And so it is, and it will, again, 5 years from now, it will be the norm across the board.
Yeah, that's great. I mean, if we can handle Pfizer vaccines at sub whatever, we ought to be able to handle whole blood, right? Yeah.
And the biggest impetus to whole blood right now is donations. Yeah. And so we started in Arlington. We started the program with Loudoun County called Heroes Give Blood. It's the Whole Blood Brigade, and so it's across the board. We're trying to increase donations for this program. And what was interesting, just a little side bit, the blood we gave to somebody last week who had a traumatic injury was donated by a Loudoun County firefighter who donated because of the whole blood program. And we can link it back, and so it's really great. We now can link the donors to the people who got the blood if they want to be linked and stuff like that. So it's a really neat program, and it's very successful, and it's being modeled in other places as well as a regional effort. VHC is a level 2 trauma center. It has a huge effect on us right now. There's a lot of law or regulations that get kind of fuzzy when we cross state lines, and so when we cross the bridge into DC, for example, if we have somebody who's under arrest, for whatever they did in Arlington and they were injured, and we take them to DC, it creates huge legal challenges for our agencies. If we have a prisoner in Arlington County who gets injured, and then the sheriffs have to go to DC because that's our closest trauma center, there's jurisdictional problems, there's evidentiary problems. So just that alone, being able to go to VHC, our turnaround times, it's our home hospital, it's where we restock. So, we drop someone off at GW, we have to stay out of service to go back to VHC to restock. So across the board, we're comfortable there. We know the people, they know us. We have a great feedback system, a great QA system, great communication with a really great hospital. And so this is just revolutionary for us because it's going to streamline and allow us to do things and really push the boundaries of what we're doing for the citizen of Arlington County in a really, really good way without having to worry about crossing state lines or going really far out of our county. So I think it is huge, and I'm super excited that Mr. Cole and VHC were willing to kind of put this up. It's not an easy process. They've been through a lot to get there.
That's great. And then I assume, I don't know how trauma centers are ranked. I assume at a level 2 trauma, that will take most of the trauma cases. Is probably only extreme that goes to, I guess it's a level 1. I don't know which direction you go.
The only difference between in the state of Virginia, level 1 and level 2 are essentially the same. The difference is level 1 has a huge academic component. So GW is a level 1, Fairfax is a level 1 because Washington Hospital Center, because they have associated residencies and medical school relationships. VHC is a standalone entity. So they don't meet the criteria of research and education for doctors and other things like that. So the only difference is the education piece. It's not the service level piece. The service level piece, in fact, ironically, the level 1, the physician group from GW, the trauma surgeons there are the same trauma surgeons that staff VHC. So that the staff is the same. It's just it's all about academics at that point, and it's really in the state of Virginia they're the same.
Yeah, that is very helpful. Quick question. I've been seeing a blood mobile here in Fairlington fairly frequently. Is that because of the whole blood program, or is it something else?
We've tried to increase our donations. And so the key component for you guys and everybody on this call is when you go in to donate, you say, I want to be part of the Whole Blood Brigade, and I'm donating for Arlington County, because at the end of the year, we can then go to Fairfax County and Loudoun County and say, we donated more than you did, because we're now tracking what county, so we've got to make it a competition, right? It makes it fun. So now you got to say, no matter where you donate, I'm donating for Arlington County, and I want it to count for Arlington County.
All right. Thank you. Makes it fun. Thank you. So these are both really exciting programs, and I look forward to in a year from now or so having a report on how, the better outcomes for patients. I think some of it will be financial, but I think it sounds like there are a lot of byproducts, to not get into the blood, whatever, but there are a lot of things that are going to come through that'll really be better because of the changes we're making, and it'll be good to track those if we can. Thank you. And that does it for me, Mr. Chair. Thank you very much, guys. This is great. This is great. Thank you.
Thank you.
Thank you. Thank you very much, Ms. Garvey. And Ms. Garvey, your question on trauma level 2 was the question I was most interested in. Want to very much thank Chief Pavlitz, Dr. Smith, and is that a vestige of a hand, Mr. Dorsey, or do you have another? You're good? So the one, certainly, I don't know if you have any brief closing comments, Chief Pavlitz. I do want to say two numbers that you mentioned that are really great to hear is 0 quarantines, and 0 cases. So just thinking of all our 370 members, grateful for your leadership and for their service in addition. Anything to close, Chief Pavlitz?
Thank you very much. Again, closing out the reduction of the work week initiative over many years. Can't thank you enough. We will bring back a lot more numbers and updates as the year progresses. We certainly hope to talk about that and also ET3 as we move forward and try to profile some of the successes of both programs. So thank you.
Sure. Thank you, Chief. So we will try and do all of public safety today. So we'll move on to our next public safety organization, Mr. Manager.
I learned long ago to keep it brief when I'm introducing the sheriff, and I'll just say one of my heroes, Beth Arthur.
Oh, gee, thank you. It's actually nice to see all of you. This whole year, I saw something posted on Facebook yesterday that said, really, we're letting March come back after 2020. And I thought it was pretty hilarious because, that's when everything hit the fan and life just flipped upside down for all of us. So it's actually nice to be in front of you all to talk about a budget this year. Last year, I immediately knew we were just going to be flatlined and it wasn't going to be pretty, but we're all managing to work through. And so I just want to say thank you. And it's really great to see all of you. And I look forward to an opportunity to actually see you in person. From my staff, I have my Chief Deputy Dave Kidwell on, Major Tara Johnson, who is going to be my slide page turner, Major Jimmy Barrett, and Major Gretchen Foster, as well as Fabiola Brooks, our budget analyst. So they are somewhere in this crowd. So Tara, are you putting up these slides? We can't sit in the same room to do this, so it makes it much more difficult. Because we want to keep people from being sick. Also. All right, so you can go to the next slide. This is obviously from approximately 2 years ago during Police Week. Just a great opportunity to be out on the Capitol steps, and hopefully we'll all be able to take advantage of that someday in the not too distant future as well. Tara, if you want to go to the next slide. Just to highlight a few things that, and I'll get into the whole COVID conversation as we move into our slides, but the behavioral health docket began operating in October of this past year, and we currently have 5 participants in the program. We hired a person, a pretrial mental health staff member who has experience working in the behavioral health docket arena in another area in Virginia. And so we were happy to be able to bring somebody on board that had some experience working on this docket. And I think that is going well. The program seems to be working well as we kind of continue to get it off its feet. Last March, April, as the county ramped up opportunities for a COVID testing site, we worked with our partners in the police department to help provide security and traffic control at the Quincy Street testing site. In addition, we also had to go through our prison rape elimination, or PREA, audit this year, as well as a VCIN, Virginia Criminal Investigative Network. I can't remember what the acronym stands for because it's been living for so long. But we did successfully completed both of those audits. I am happy to say we have made a lot of adjustments with technology, enhancing operations, some of them challenging, but we've been managing to continue making things work. And I'll talk some more about that in a minute. Our body-worn cameras have been implemented, and we have 30 cameras that we got through this first implementation of cameras, and they will help us both with my staff that are out in the community serving civil process warrants, criminal warrants, those people that are in the community, as well as helping us continue our partnership with the police department on events like Marine Corps Marathon and other activities that hopefully we will be doing in person soon. Tara? Some of the other things we were doing this year is normally we've done a really robust food drive, but with COVID, a lot of limitations for people, we decided to do a cereal drive specifically for AFAC, which they were very happy with. We collected 600 boxes of cereal over several weeks. We also have instituted blood drives within the sheriff's office, and we've increased that from 1 a year to 2. Clearly, we need to be working with Dr. Smith and Dave to make sure we're partnering to connect that into their blood drives in the community as well. In addition, we utilized our inmate workforce and helped train them on how to make cloth face coverings so that we could have them on hand to pass out to any newly committed individuals to the jail. Each individual literally walking through the door. We clearly had to create a lot of COVID protocols to minimize exposure to staff as well as individuals in the jail. But one of those things that we did was have them help us make cloth face coverings and keep us in stock between donations through the community and through having inmates help us with that. And so everybody that comes into our custody is given a face covering from the minute they walk in the door. They have a couple on hand, and when they leave, they take them with them. It also provides us with some on-hand items to have in the event that somebody from the public comes into the courthouse without a face covering, that we can give them something as well. We also were able to raise additional funding we've been working with Virginia Hospital Centers Foundation, trying to raise money for breast cancer and for their women's clinic at the hospital. And so this year we were able to present them with a $7,000 check. I will note that $5,000 of that came from our friends, the manager at Coons Toyota on Lee Highway. Manager happens to be a good friend of one of my captains, and he's generously worked with us to match funds that we've raised. And then this year he stepped up with even additional dollars. So we're very proud of continuing that relationship. And we take all of our female inmates that need female specific care, especially our pregnant females. We utilize the clinic at the hospital for all of their care. Tara? Budget highlights. The manager has proposed that that we get another lieutenant position, actually a new lieutenant position that would be specifically responsible for all of our video and body-worn camera footage to review and to respond to FOIA requests. As we were talking about the body-worn cameras, I was like, hello, do you have any idea how many requests we get for video footage, in particular from the booking and processing area of the jail for individuals that might be brought in for a DUI charge? There are a lot of regulations and rules around managing that process. And so this position will provide us with somebody whose job and responsibility it is to manage all of this. And they will also partner with the police department's manager of their body-worn cameras as well. Telephone contract, we currently have on the street. Thank you, Maria, wherever she is out there. We have a contract on the street for a new inmate telephone system. This is a system that does not cost county taxpayer any dollars, but we are working towards getting a system that will have tablets, which will allow us the opportunity to have both video visitation, college coursework potentially for inmates, as well as providing any other types of programming. And obviously, after the last year we've been through, it would have been nice to have had this system in place a while back, but there's a lot of technology involved in a jail that, it's prohibitive of bringing in new technology without a lot of retrofitting up front. And so all of that will happen with our new phone contractor. And that, I think it closes sometime in the middle of this month or early April. So we'll be moving forward with that. Inmate tray slots, several years ago, we started adding in a few inmate tray slots for a couple of our housing units, in particular the mental health unit and our restrictive housing unit for people that either just really cannot conform to the rules and regulations of being in jail, and or somebody that might have very, very serious criminal charges, violent criminal charges. And so we wanted some tray slots. Mostly they're for literally somebody that we can't have come out and take their tray without them just not being able to do it in a safe manner for them or staff. And so they're fairly costly because you're retrofitting steel doors. And so we're getting additional funding so we can continue adding a few more of those. New workout equipment. Again, this is an item that is not paid for through county tax dollars, but it is a project that we've been working on. We use inmate canteen funds, which is slotted to use to do things that, come back to benefit the inmates, and our equipment was just worn out, no longer repairable. And so we are working through putting in new equipment in each housing unit. And so we started doing a couple beta sites in 2021, and we'll continue this process through 2022. This is our new vending machine that we did a couple beta sites. You can see the picture here that we have put in a couple housing units. One is one of our intake units. We put it in because if somebody comes into the facility and is going to be there for, it takes a couple weeks to get them into a general housing unit, they might miss out on getting any canteen items. And so you can't purchase anything through the system if you don't have funds in your account, but it does allow access to items that are sold, with the exception of the sodas, that are sold within our canteen. And again, we've had to pay to retrofit the station where these are going, but all the other expenses are paid for by the vendor. The machine belongs to the vendor. They stock the machine, and they pay for part of the retrofitting to bring these machines in. And so we will probably be expanding them. It also minimizes bringing somebody into a housing unit and potential exposure with COVID. So it is has been a good benefit for us, especially with COVID going on. Tara? So COVID, I never knew that you could really operate a jail and be quite as agile, fluid, adaptable, flexible. It's been an interesting, challenging year, not just for myself, but certainly for all the staff that work in the sheriff's office. We've just kind of gone with the flow as best we can, and that's really not the way most of us operate in public safety, and it's certainly not the way that we normally would operate the jail or the courts, for that matter. So I'm very happy, and I give all the credit to staff for, listening and doing what we, educated them about. But we kept COVID out of bringing it into the facility to expose an inmate that was incarcerated in our facility for extended period of time for 9 months. I can tell you that my friend in Alexandria and my friend in Fairfax have not been as lucky, and we've been trying to help out the Alexandria Sheriff's Office as best we can. There's a lot of constraints that have gone on because we've had to adapt and create 4 intake housing units, 2 female units, 2 male units. We bring in, for 14 days, we'll take in individuals on the female and male side. And then at the 14th day, we shut that unit down, and we don't bring any additional people that come in, from the community into the jail. And then we start a new unit. So that one unit gets locked down for another 14 days. And when I say lockdown, I don't mean literally that they can't get out and do anything. I mean lockdown in the aspect that we're not bringing any additional new individuals into the unit, with the exception of staff and medical that need to come in and out. So we're doing that, having 2 female, 2 male units, which is, required us to take up 4 housing units and make some other adjustments in the unit, but it has really been very successful to date. And so pretty much that's what everybody's trying to do around the region. As we all got into, we set up a team that talks on a regular basis to Fairfax and Alexandria, so we can compare notes. We can share each other's, successes and non-successes along the way. We also, we had an electrostatic spray cleaner prior to this. It was on its last leg, and we finally got a couple additional units. We use those to keep the jail clean. We still are using those to keep the jail clean, but we also worked in the courthouse for several months helping maintain the cleanliness until the county's DES could get in and bring in additional cleaning opportunities for the courthouse. We have suspended roll calls following CDC guidelines. So we've kind of, if we can have 25 people in a room, we bring roll calls back. If we can't have 25 people in a room, we haven't been having roll calls. We've been using other options to do training as well. And so using SharePoint, Sheriff's internal system to communicate, and again, adapting as we go along. In-person visitation for inmates has been suspended for a year, coming up on March the 13th. Staff are working on a plan that we can try to come up with some way that we can start allowing visiting to come back, especially now that vaccines are out there and we have more staff that have been vaccinated. Our inmate population, some of them have also been vaccinated. So moving people around becomes a little bit less of a heartache for all of us to try to minimize exposure to COVID. So we're working on that plan as we speak, but some things that we did in order to help ensure that individuals, A, we maintained good morale with our inmate population, but B, that we needed to make sure that they could keep getting visits with their family. So again, we sort of have adapted with what we had on hand, and DTS has been helpful with us with Surface Pros and iPads, doing some FaceTime visits for inmates, working with our vendor on our phone contract and giving 2 free phone calls a week to individuals, so that helped eliminate, some of their visits, and families weren't having to pay for all those phone calls. So we've been continuing to sort of, see how we can be flexible and work to make sure that we're giving them the best opportunity we can for those visits. I mentioned the quarantine units. Our pretrial program, we made a lot of modifications to that, especially up front. Our courts, I have to say, give the judges kudos for being very flexible and really evaluating whether somebody needed to be in jail or they could be put out in the pretrial program. But what did that do? That sent those numbers way up. We have probably 325-ish people that are in pretrial. Of course, our new Commonwealth attorney with the no bail also played into some of that, but this sort of dovetailed closely in together. And so the courts have been great. We've all been working together, to ensure the safety of the community, but also trying to minimize who's coming into the detention facility. We've increased teleworking opportunities for staff, but obviously I don't have a lot of staff that teleworking works for. Most of my staff, I need them to come to work. I need them to come to work in the detention facility and our courts, courthouse, service of process, and so forth. So where we've been able to, we've been been as flexible as we could, trying to utilize technology and working with staff. On top of, as we all know, for those of you that have small children, I just say thank you that mine are grown and they're not even in college to be dealing with all this that everybody's dealing with today. It gives me anxiety just to think about it. It's been a tough. So we've been trying to be as flexible as we can with everybody, trying to understand that. And just another note, our mental health population, we've seen an increase in the population that we do have, that a lot of individuals have very serious, much more severe mental health issues that are going on. The manager was asking me the other day, like, if I could sort of pinpoint why that is. Well, my first response is I think we all, have seen ourselves, a lot of people that have more anxiety or higher concerns for mental health and well-being just because of the way we're all living our life. We're not doing our normal thing, and we're not seeing each other in person. And this is obviously, you all know that as good as anybody because you've been meeting virtually for a year now. But we've seen a large increase in motions. We call them 169 motions. Because of mental health issues. These are people that really should not be managed in jail. They should be in a mental health facility. And so finding beds for those individuals and dealing with those individuals is always a challenge. Our partnership with DHS makes it much easier for us as a community to manage that because we do have such good working relationships and we do have robust mental health staff in the jail. But it certainly has been a challenge for those mental health staff, and I give a shout out to Anita Friedman and her team that work in the jail, because they really do a fantastic job. But it has definitely, we've seen an increase, in this concern. And part of it is just trying to, if any of us wanted to even just talk to somebody to deal with everything that we're dealing with, it's very difficult to find somebody to that has the availability to talk to somebody. So that then creates anxiety. Everything's being done by telemedicine, which has its pluses and minuses. But I have a psychiatrist that lives up the street from me, and she does see nobody. She sees none of her patients in person, since last March. Everybody is through telemed. And we were having this conversation, and she said, sometimes it's okay, but sometimes it's hard to read your patients. And so I think that is part of why we're seeing the increase and what we're seeing. And with individuals is just everybody's struggling. The other thing is that we also, we forget sometimes that we also have the airport. And we get people that are arrested at the airport, people that, might be here from another region or within this area, but across the river in Maryland or DC, that might have government, issues, that they don't like government. And you have the Pentagon that sits here. So these are some of the antidotes that were provided to me by staff. So those are some of the things that we've been, dealing with this past year with COVID. Tara. Our ACT unit, our Addictions, Corrections, and Treatment unit, has had to make adjustments, and it's been shut down twice this year because of COVID with staff concerns. And so, we're doing the best we can, but it's definitely been more modified. Our Community Readiness unit that we stood up about 2 years ago has obviously seen its challenges as well. A lot of the people that might come in are volunteers. No volunteers have been in the facility for a year. We have been working with Offender Aid and Restoration and been able to get some of our programs back up and running. Again, utilizing technology, which is good. I mean, these are all good things, but it also has, put some dampers on some of these opportunities. We've introduced virtual learning, as I mentioned, working with the OAR. One of the pluses is providing religious services. We're able to, because a lot of churches now and different denominations are providing services either through television or, virtually. And so we're able to provide those opportunities to the population. And in lieu of worrying about getting somebody that can come in and provide those services. One of them in particular that's always been a challenge for us is providing Muslim services. And so this, has really created, some very good pluses. In addition, inmates that may have a family member that passed away. Most of us aren't able to go to family funerals either, or friend funerals, but we're able to let them attend via virtual, using FaceTime or working with families and making that happen for them. And obviously our courts, initially, as I indicated, the courts have been just fantastic. Up and down the board, some of the judges, like myself, were not necessarily as in tune with technology, and they adapted. They, DTS really was just, helped us all get things up and running. We certainly could do arraignment hearings, but that just became much more robust than what it was. The minimal movement of inmates from the jail to the courthouse has really been down. And so that has been a huge plus in bringing that to bear. It has not reduced staffing needs, but it definitely has been a big plus in helping us. We have to date had no jury trials since last March. There are currently 2 scheduled over the next month, and we will see if they end up coming to fruition. But the circuit court had to put together a very robust plan on how they would safely hold jury trials. They brought us in, as well as the Commonwealth Attorney, and we all participated, Public Defender's Office, in making sure that everybody was comfortable in moving forward jury trials. So that should be getting underway, hopefully, but we'll see in the next couple weeks. Evictions, I know Mr. DeFerrante and I have had several conversations about this topic. We are continuing to work within the CARES Act with the Virginia Supreme Court. The evictions that we have had are related to things that were really in play before last March, and we are working very closely with Department of Human Services, with our contact there and Legal Services of Northern Virginia. Anytime an eviction notice is served, anyone is provided with a list in multiple languages of where they can contact in order to get services. And again, Legal Services of Northern Virginia, we actually are working with DHS. We have a spreadsheet. We're all sharing the same information. They're reaching out to people. And so to date, the only evictions that have happened are really what they call lockouts, where you go in and the person almost always has already moved and they just change the lock on the unit. And that has not been a lot, but those, again, are people and situations that were already in play prior to last March. Tara? Our focus on equity. Last year, when we started talking about this issue, I went back and we were charging individuals if they wanted to have a medical appointment. There was a $5 or $5 and $10 sick calls. We removed all of those calls, and in addition, all of those charges. In addition to that, we also waived any debt that anybody that was either in jail or had been in jail, that debt has been removed from their record, and so that is no longer there. I can tell you I know the whole reason when we first moved into the new jail 26 years ago, almost 27 years ago, was because in the old facility, people would just try to get out of their units that were little teeny, 6-bed units that they were stuck in all day long without being able to get out. And so you would just have this high volume of people that were just always constantly streaming in wanting to go to medical with some issue or another. And so that's really where the fee process came from. It also is allowed, and a lot of places do it, but we eliminated that. In addition to that, we give out what we call indigent kits, which we're required to do for anybody that comes into the facility gets a kit. In essence, it's the hygiene kit that we all might buy for travel purposes that we can carry onto, an airplane with us now. And so they're getting a hygiene kit. And once they're in custody, if they don't have any funds, we continue to provide that to them based on the amount of money they have in their canteen account. So we've eliminated charging anybody for that. We're also working on figuring out with our vendor, just give you the items you need. You don't necessarily need a new tube of toothpaste when you need shampoo and so forth. And so we're working on that, but we're no longer charging for that. In addition, just so that you know this, everybody is provided with the toilet paper, soap, as well as feminine hygiene items. There's no charge for those items, and they are readily available for individuals that are remanded to our custody that need them. I know that issue comes up from time to time, and there is no charge, and there's, the products are there for people. We provide, I mentioned the free phone calls and visitation that we added this year, which that really had more to do with the pandemic, but we still wanted to do things that helped individuals. Leadership, we did leadership training on challenging racism. We had met with Mary Hines and several other people over a year ago, and it took us a while to get the state to allow us to get in-service credit for this program. And so we will continue to advance this into some our sergeant level staff over the next couple of months. But it was a really great opportunity for myself to and command staff, but to do this training from our lieutenants up. And so it was really terrific. And we would have done everybody, but for COVID, we could only put 25 people in a room. Implicit bias training has been completed by all staff. And in addition, I have a command staff member that's part of the racial equity core team. And I have 2 members that participated in the restorative Arlington work groups. I also, and Terry, you don't need to change the thing, but I did want to mention that I know the chief mentioned this, but after last summer, as a lot of conversations took place about diversity and inclusion and public safety, we did have a staff member that came to me and requested an opportunity to hold meetings and talk to staff which I would happily have participated in, but I was asked not to. And so I allowed them to have that communication and discussion, and then they came back to me to talk about some concerns and issues. And so we continued to work on having these discussions. I'm very open to it, as I think we've talked about in the past. My staff is very diverse. 50% of my staff are Black and brown, and so it's very important to me that we have these conversations and that we educate each other on how we can all, work better together and ensure a safe community. Our budget. Okay. So our overall expenses are reduced by about 3.2%. Revenues are down 1.9%. And then our overall funding with the freezing, not reduction, of 10 FTEs in this FY21 or 22 budget. I'd like to also note that currently in the budget, the General Assembly has been working on, there is a 5% increase for state compensation board funded positions in the sheriff's office. So that's all state compensation board funded positions. That 5% equates to about $350,000 additional revenue dollars, and they actually have put that in for a July 1 increase. So our association has been working to try to increase that, but at least we think that we'll see a 5% increase in our state compensation board salaries. Tara, thank you. Body-worn camera position, I mentioned that earlier. I really think this is a position that is desperately needed for us, not just because of the body-worn cameras, but also because of all of the video footage we have in the jail and the courthouse, and the fact that we are subpoenaed on a regular basis and get requests for that footage, and it will, instead of us doing it on a catch-as-catch-can basis, you'll have one person responsible for that. I mentioned the 10 vacant. We currently have some vacancies. This is a proposal that we would freeze 10 of these vacant positions for FY22 because of the budget circumstances that we're in. And I'll talk some more about about that in a second. The records assistant 4 position is what we call a booking clerk. It's a data entry person at the booking and processing point that currently is vacant. And so we are proposing freezing that. And then I'll talk a little bit more about making some adjustments to the way we run roll calls moving forward in FY22. Tara, I feel like I should be saying Vanna. All right, so in putting forward a budget and a recommendation to freeze 10 deputy positions, we are currently have 22 vacancies. We have seen a 13.9% turnover rate in 2020 calendar year, which was higher than the 2019 calendar year. And I will honestly say that with COVID, and we just didn't adapt to figuring out how we needed to virtually really get out there and do some recruitment. And about 6 weeks ago, I made a decision to pull a full-time staff person to focus them specifically on getting us out there and getting people into seats to take our deputy sheriff test. And we only, right at the moment, or maybe we'll be able to adjust this, but right now we're only doing 10 people at a time. And so we're having to do the test more frequently, but we have seen an increase in the number of people because this individual, once somebody applies, is calling them personally, making sure they're showing up for the test, doing a reach out, doing an email the day before and so forth. And so we're doing that. We're getting on virtual job fairs, reaching out to colleges that have programs that might, correlate with public safety, social, psychology type of degrees. And so we're working on that and looking at other opportunities and ways that we can enhance and have a more robust outreach program. So that is something that we have been working on very diligently over the last, like I said, several weeks. But we have ramped that up because, even freezing 10 positions, as you all know, over the last several years, I've really worked hard to get 15 additional new deputy positions because of lockdowns in the jail and our inability to do programs, to move inmates around, to have them participating in things that will help benefit them so that they can return to the community as good, productive members of Arlington and our surrounding jurisdictions. And so I feel like losing these positions beyond just freezing them for a year is going to be a really critical for our operations and for managing and running the jail in a safe manner, making sure that staff are not working way more hours than what they should be working, making sure that staff, have their morale is up, that they're not fatigued both mentally and physically. And so, I don't want to find myself back in a position where I'm having to mandate that staff work overtime. It costs all of us a lot more money. It costs, the budget a lot more money, but it also costs turnover. And so I think it's really important that, we just focus on these positions being frozen, and hopefully if budget is looking up, maybe they can be filled sooner rather than later. And I'm sure the chief of police will probably talk about some of the things that we've all been working on for staff's mental health and mental well-being and public safety, and the program that we started, and we've hired a person to do that. And as we continue to work on these issues, I think this past year has been a stressful year for everybody on the COVID front, on the public safety, justice reform front. And so I think everything that we can do to ensure staff are both physically and mentally healthy is really important to ensure the safety and security of our community. The other thing too, vacancies, obviously, when people are out sick, managing COVID, people that are being quarantined, allowing for vacations, and training. These are all important parts of what we do every day to make sure that we're running a good organization. Tara? I mentioned the records assistant. This position, I am perfectly comfortable freezing for the next year. It is our overstrength position, so it means that it will be covered with overtime. In lieu of having somebody that can fill in for training and vacation and sick calls, but I am fine with us freezing this position for the next year. So one of the proposals that we made was, and obviously having to go from in-person roll calls to virtual roll calls allowed us an opportunity to really evaluate our roll calls that we're doing, in particular for jail staff right now, or normally we would meet 15 minutes prior to shift change, go through any issues, concerns, assignments, and then staff would report to their post. They would relieve the deputy that they're transitioning with, and then they would leave. So it was an extra 30 minutes of overtime. What our proposal is that moving forward in FY22, that we would host roll calls the first day back on their work schedule. So we work a 3-day on, 2-day off rotating cycle, 12. It's a 14-day cycle. You work 2 days, you're off 2 days, you work 3 days, you're off 3 days, so that every other weekend they get a 3-day weekend, and theoretically. And so this will allow us to only do roll calls once, and then we will use virtual options for the other 2 days or day that they're on the shift to share information and so forth. So it should save us additional overtime money. That is what that is about. Key budget considerations. Technology, one of the things that we've done, we've created these mobile workstations that we're utilizing to help bring programming to our inmates in housing units. And so they're virtual training stations. That's how we've been able to work with offender aid and restoration and to do some other things. And hopefully, as we continue to move forward, and I don't know about you all, but I'm thinking we're going to be in this for a few months. I don't know that we all really expect it to still be where we are in a year from now, maybe wishful thinking, but at any rate, so we want to make sure that we, continue to have options to bring programs to individuals that are remanded to our custody. And so going back to some of our volunteers, a lot of our volunteers are older. A lot of them come through religious groups. And so it may be that we can continue to bring some of those volunteers in to do volunteer work, but just not physically do that. And so I think, as we continue to figure out how we're moving forward, trying to bring back some visits, trying to bring back programs, what does that look like? And so we're continuing to build these workstations and having them available to use in different areas in the jail. We had some money through SCAP, and don't ask me what SCAP stands for, but it's money we get through the federal government and through a illegal alien application process. And we utilized some of that money to resurface the two showers that are down in the booking and processing area. The building is operationally 27 years old in April. And so a lot of the showers in the jail, you just can't get them clean. And so despite working with DES and trying many options, there's just really not a lot we can do to enhance making the showers look better. And this program costs about $250,000, but it resurfaces it would resurface every shower. Every housing unit has 3 showers in it, with the exception of our on the 11th floor where we have our maximum security and our mental health units, and they don't have as many showers, but it would resurface them, and it's amazing. They look fantastic, and they're much easier to clean. You don't have to worry about mold and mildew because it's a line process that doesn't have any grout in it. It doesn't have any seams in it. And so it's an epoxy kind of process that you do, and I don't do, the company does, but it really definitely enhanced. You put it up the walls and on the floor, and so it just really makes the showers fresh and clean and easy to keep up with. And so that is one of the projects that we're looking to try to get funding for. And recruitment efforts. A lot of the technology options cost a fairly significant amount of money. And so we got a one-time recruitment budget, I think, a couple of years ago, but it wasn't a sustained budget. And I think recruitment and outreach needs to continue to be something that it's just a constant, filling and hiring jobs. It's not something you can ramp up and ramp down, at least from my perspective. And I've been doing this job now been doing this job for 20 plus years, but I've been working in the sheriff's office to include recruitment, outreach, and budget for 35 years, probably older than Katie is, Miss Crystal is, or almost. And
beat you by a year or two, just barely.
So she was a baby. Her son was younger than, is older than she was. But at any rate, so I've been doing this a long time, and it's just a process. It's cyclical, and we just have to keep at it day in and day out to try to recruit the good people that I want to hire and that I think you want to have representing us in the community. So with that, I'm happy to answer your questions.
Thank you, Sheriff Arthur. Appreciate it. Colleagues, questions. I will say, just to start us off, a big thank you for the eviction work that you're doing and your team is doing. And also, I know the pretrial work, that was a big shift in your work this past year. So really appreciate you kind of leaning into that and making some leadership, adding some people. And so I think appreciate that. So Ms. Garvey, you have a question. You're on mute. You're still on mute. Sorry. Has to happen once a day.
That's that Academy Award this year. Somebody did that the other night at the Golden Globes. It was pretty funny.
Oh, it's very funny. We at least we laugh.
do it
so
all
we
the time.
don't cry about it. It's fine. Everybody has to do at least once a meeting. Anyway, I was just saying it was great to see you. I don't want to take too long because I know we're trying to get through a lot. And so this might be the start of a conversation later. I mean, I'm assuming that you found there are things, and you've alluded to that were working better better for the inmates, better and more efficient. And I assume that you're thinking about what you're going to keep up. You've mentioned some of that. One of the things I thought, the things for morale, inmate morale, I mean, I'm wondering if maybe helping inmate morale might be something that would be good to do just all the time, whether there's a pandemic or not. And I don't know what we charge on phone calls, but that's obviously, we all read these horror stories about people in jails that are, they're incredibly expensive phone calls. They can't even afford to talk to people, and how harmful that is. So I really appreciate the tablet work, all of the stuff that you're doing. But I would be interested, moving forward. I just think there's probably a lot of lessons learned, and I think you do a good job in the jail that we can do even better by keeping some of these things. So if you want to talk about it a little bit, but we can talk about it another time too.
The first thing I'd say is the inmate morale issue is really mostly based on the fact that they're not getting to have their visits with their family.
Right.
And the programming that they're used to having, so that we normally have such a robust amount of activity for them to do, that inmate morale is really not an issue. I mean, a couple other things we did was we enhanced 1 day a week. We've enhanced their meals, which is a small cost to my budget. But outside of that, everything has been done that's not costing the county any money. And we just a couple weeks ago gave every inmate like a goodie bag, a canteen bag, sort of saying thank you. You all have really been hanging in here this past year. And we really just appreciate their willingness to sort of, they too have gone with the flow, like all the rest of us are doing. As I said to one person, he told me, he goes, "You're choking us. You're not." I said, "Look, we're all, you think we're all doing the same things, that we're normally used to doing, we're not, nobody is doing their normal activity." And so I think the inmate morale piece really is just strictly all about, because COVID has really limited what we can do. And while there are some things that I think are good, there are plenty of things that I could say to you have made it much more of a challenge, and definitely not being able to allow visits and not being able to bring in and have the robust programs that we're used to providing and opportunities for individuals it's really been tough.
That's really hard.
But I think that runs this organization. And just so you know, I am very, very adamant that we do not overcharge and, stick people with phone call costs. But that is now actually regulated by FCC. And so what we were charging before, whatever revenue we make off of that has pretty much stayed the same, because we never overcharged. I never believed in it. I always felt like you're gouging, family members and loved ones, and it's just not appropriate. And our canteen items, we're going to pay the same thing. They're going to pay the same thing for canteen items, which are candy bars and chips and soda that you and I pay for. If we go out and buy them in a grocery store or in a 7-Eleven, I do not believe that it is appropriate for us to be overcharging and making money, at a level that's above and beyond what would be appropriate for any of us to spend. So
thank you.
Just so you know that.
That's helpful. That's what I wanted to sort of elicit. Thank you. And, and I will say, once those tablets get in there, because there always are family members, people it might be hard to visit, or, all kinds of reasons people can't visit. And once we get those tablets, I think that may really help keep people connected, which is crucial. Right. Okay. Yeah. Now, so thank you. I know it's been a tough year.
They will cost money like phone calls, but it will be a reasonable, it'll be in lieu of like a phone call. You can use the tablet and do the visit. But I will promise you that I will ensure that they are maintained at a very reasonable and appropriate rate, because they don't cost the county money. Mm-hmm. So there is a fee process there. So I cannot tell you what that cost is going to be until we have a contract and we negotiate that contract.
Mm-hmm. Yeah.
But my goal is to the opportunities that it will provide us. I have a college that's been waiting for 2 years that's willing to provide free college coursework to individuals. So there's a trade-off there that, that they might get this free, and it should help us be able to enhance GED programming and some of these other programs that we're doing that don't cost additional dollars. So, but when I see what that looks like, I will share it with you, and I'm happy to have that conversation.
Yeah, no, that's great. Once we get open, I haven't had a tour of the jail in a long, long time. So once we can do that, love to get back in and walk around and see the place again. Thank you.
Thank you, Ms. Garvey. I think Mr. Dorsey and then Mr. Karantonis.
Thank you. So, Sheriff Arthur, appreciate the presentation, and you anticipated my question. Ms. Garvey did as well. And thank you for your philosophy on setting fees for setting prices for canteen items. That's essential. And in addition to price of goods and services and fees that may be charged, the other side of the equation is what people are paid if they choose to enroll in an inmate labor program. And it's my recollection from when we surfaced this issue with your office, I can't even remember when at this point, but Arlington stood, at least on the high end in the Commonwealth of Virginia, for what what was paid per hour. My question really is, though, is there any benchmarking that you look at or other communities that you try to peg Arlington to determine what is the right wage level to set for inmate wages? And the reason that I ask this question is because as we consider a criminal justice system that requires restitution of fees as a critical element of justice, as we consider forays into restorative justice, which could include compensation in lieu of other things, et cetera, it becomes incumbent on people to be able to, make what they've earned and to be able to save and apply those so that they're not in this perpetual cycle of indigence. So that's where the question comes from.
That's a very complex question. I can tell you because we've had it with some groups earlier this year, or not this year, but in 2020. So what we're paying our inmates is very minimal. I will tell you that, but we pay them better than other jurisdictions are paying them. Does that not mean we couldn't do better? Yes, it does. And it is one of our issues on the table, but like many things, it kind of got set in a basket because COVID is pretty much taken over our lives in many respects. The amount of time and energy that gets spent there is fairly significant. And particularly for my staff that normally would be focused on doing a lot of these things, they're between managing staff and making sure that we don't bring COVID into the jail and doing contact tracing. I mean, it's a lot. But having said that, part of their issues are individuals that participate in work programs, whether they're getting paid for it or not, are getting good time. So that good time helps reduce their sentence. And then, like, for instance, our kitchen workers, we also give them double meal portions or additional meal portions. That doesn't really help answer your question, I don't think. And I think it's something that we need to do better on. The question is, where does that money come from? And the other thing, though, is that, I've had people say to me, they should be making at least minimum wage. Well, if you pay, I'm glad that I see you agreeing with me on that. At least I think you did. Because if you're paying them minimum wage, what is the incentive to not just say, I'll just stay in jail until my time is served? Because I can make minimum wage, I don't have any room and board, or then do you charge room and board? And so there are a lot of philosophical questions that go into that. I get both sides of this conversation, but you don't want to de-incentivize a person's reason to participate in GED programs and participate in substance abuse treatment programs and participate in mental health programs or other different types of programs, and then, not want to return to the community in a better place. And so there's got to be a balance, I think, between paying them something that gives them some money, in their pocket, if you will, in their canteen account, or that they could release to a family member for whatever, versus paying a minimum wage. And so it is, but you have people on both sides of this conversation, that think that I should be paying them minimum wage or $15 an hour, and then they can't get good time if they do that.
Yeah, there's perhaps a third way. And I mean, right. the minimum wage proponents, there's also the unexplored consequences for the broader labor market right. if you shifted that. So that is a much bigger lift. But whether or not there are ways to think about a living wage for people who are in detention, that's I think a new area of research that I don't know much about. I've only heard about at the margins. But it's something that, considering your overall philosophy, I think it when we have the space for you to engage in that, I would recommend it, because you're at the forefront. I mean, most places gouge the heck out of detainees for Doritos and deodorant. And, the fact that you are, mission driven to not do that means that we're sort of half of the way there. So thank you.
Thank you. Thanks for the question. I appreciate it.
Thank you, Mr. Dorsey, and Sheriff Arthur for the mission points that you made. Mr. Karantonis.
Thank you, Mr. Chair, and thank you, Sheriff, for the presentation and the good work. I was really impressed by the low incidence of COVID in the jail, 0. That's impressive. That's really impressive, I have to say. And I congratulate you, commend you and your staff for this. That's not easy. I have to say I definitely align with Mr. Dorsey on his comments. I do believe that a living wage consideration at some point should be part. This is a very complex area, but we shouldn't be precluded from thinking ahead and be equally mission driven. What I wanted to ask you though is, this year we had a death of an inmate in the jail, unfortunately, and I don't know whether the technology improvements or even there are parts in the budget that should be taken into account if we have to put even more safeguards in place to monitor better. You talked a lot about mental health issues, etc. So I'm open to hear whether there is something we can improve there to make sure that we keep tabs on people in extra difficult times. That it's both for inmates and for personnel.
And I can't specifically talk about the inmate death that occurred. That is still an ongoing police investigation. Our current policy is that the police department does investigate any inmate death in the detention facility. It has been that, for 35 years, and they treat it as any other death that they would, deal with in the community. And the acting chief may or may not speak on this, but Jay Farr was an instigator, that's probably not the right word I would want to use, initiated a conversation to create a regional team that would investigate issues, law enforcement issues, because I know there's a lot of concerns that you're investigating yourself and so forth. And so I believe that that's close to actually coming to be. And so in the future, likely he would ask that somebody else come in and do that investigation. But then they would, if there's any misfindings or whatever findings, it's presented to the Commonwealth Attorney. And the Commonwealth Attorney will, if they, do their job as well. So, and that, I can't, like I said, get into specifics, but I can tell you that in each and every case where we have had an inmate die in our custody, first of all, I take it very personally. And I, many times it's health-related issues, because a lot of the people that we deal with do have serious health issues, and they may or may not be being tended to when they haven't been incarcerated. And so, those are things that we have to deal with all the time, and obviously managing with our medical contractor and vendor, working with VHC Hospital. If somebody needs to be hospitalized, they are hospitalized. I just had an individual, I'm not sure if he's back or not. He's been over at VHC Hospital for, I think, 3 weeks with medical issues. And so we have a staff person that staffed that individual 24/7 while they're in the hospital to ensure, again, the safety of the individual, but the safety of the hospital and our citizens and community as well. So each time that we have had these circumstances, we review the instance. We will make adjustments to our policies and procedures. We will work with our vendors if that's the need or concern, to ensure that we make adjustments and changes. And if the adjustment or change is going to have a fiscal impact, it's not going to keep me from making that change. So, and if I feel like I needed to come back to the manager, to you all, and ask for something, I would certainly do that. And I wish that I could get into more conversations of specifics, but I definitely, have made some adjustments and to ensure the safety and security of everybody that is remanded to our custody. And I take it very, very seriously. And I look forward to having you, when we get back to a place where we can walk around in the jail, come over and take a tour. Now that you're on the board, welcome. I haven't actually even seen you except virtually at county board meetings and so forth, but I just want to say congratulations and welcome to our budget process.
Thank you. Last time I was visiting the jail was quite a while ago. It was in 2010 last time. So I'm absolutely certain that a lot has changed since then.
Leadership Arlington?
That's correct.
Good. Yeah. This is our first year of not being able to do that jail tour.
Mm-hmm. Thank you, Mr. Karantonis. I do highly recommend the tour. It's a very helpful. Ms. Crystal.
Thank you, Chair Arthur. Thank you for that extensive presentation. It's hard to believe there are any questions left to ask. Just one I wanted to talk about. You mentioned in passing 5 participants now in that mental health diversion program, which is great to see that up off the ground. And I know, that's really serving people who are sort of in crisis level mental health or who have crisis level mental health and behavioral health needs. And I know you've also mentioned, as you talked about today, for a number of years, that increasing the vast majority of those detained at the detention center experience, either have a diagnosis or are struggling with undiagnosed mental and behavioral health issues. I wondered if, as a result of the sort of dedicated staff person for that alternative docket and other participation of your staff, if you're seeing any sort of benefits that could accrue to the broader population of the detention facility, even if it's just sort of greater awareness about mental health services among your staff members, or is it, such a different and kind of separate judicial track that there's not a lot of overlap between bringing services to the overall population in that new docket?
Well, the new docket and the pretrial program is really sort of a little separate function that happens within the sheriff's office. And we are, I think, the only sheriff's office in the Commonwealth that is actually managing a pretrial program. We were one of the state's first 3 beta sites. And so it's sort of, its own, like I run the Alcohol Safety Action Program as well, and it's sort of on its own track. Although the pretrial staff do work in the detention facility, because they're interviewing individuals that come in, they're going through a process to inquire to see if they qualify to be placed on in the pretrial program and presenting that in court. So this person is coming in and they're also working with those individuals that are in the program. I didn't mention this before, but our jail population is at about 250. Our pretrial program is at 300 of supervised and about 25 that are just sort of reminded to show up in court. And so they needed another position. We actually need another position to work in that program because of the amount of activity that goes on with each individual. Having said that, DHS has robust staff that are in the detention facility, that work there, that are assigned there. They have a team that works interchangeably with my staff, with our medical vendor. And so I think anybody that's in the facility for any period of time is absolutely exposed to what mental health services are available to them in Arlington. And then if they're not Arlington residents, because 2/3 about of our population are not, they try to connect them with whether it's another Virginia jurisdiction or Maryland or DC to at least point them in the right direction and connect them with services. And so I think that we really do a very good job in the partnership that we have with DHS in making sure that people are well aware. And I think I could be speaking out of turn, and somebody I'm sure in this call will correct me. I think DHS may be getting a position through a grant funding to help work also with the population when they're returning to the community to connect them to services, or they already have a person that's doing that. So the readiness unit that we have is also a partnership with DHS. So they're very heavily involved in working in that readiness unit to work with people so that we're making sure that they're connected to services when they come back into the community. So honestly, I can say most of the people that we have that are working with us from DHS have been working in the facility for quite some time. They've been around a long time. Aubrey, who is now the supervisor, Suzanne Somerville for a long time was the supervisor in the detention facility, and she got promoted and left us, but she still oversees the program. So she's actually still, pretty heavily involved because her fingers, she just has real empathy for this program. And so I think we do provide that already. That doesn't mean we can't ever do more.
Right. Well, thank you. That's really helpful.
Thank you, Ms. Crystal. And from my part, I want to just another thank you to you, Sheriff, for supporting the implicit bias training with your team. And I appreciate the balance between pretrial and pretrial enough staff on the pretrial side is kind of my greatest interest. I'm also mindful. I'd like to follow up with you directly in a conversation about that. I appreciate also Mr. Karantonis's question. I'm a little mindful of time because we're trying to do just a couple more entities before 6. So I will follow up directly with you,
Great.
Sheriff Arthur, if that's.
Thank you.
Yes, and I do have to say that helping stay COVID-free for the 9 months and COVID few cases in total, really appreciate that. I know it's been I can only imagine how difficult a year it's been with the flexibility you've needed. So just a thank you, and any closing comments from you.
I did want to just say thank you for the opportunity to have this conversation. I'm always available for questions to all of you, but also to the citizens of Arlington. I mean, like you, we work for the citizens. And so I appreciate the opportunity to talk about what we do. I could do it all day long, but I do want to give a shout out to the Implicit Bias Training Group because it was a great opportunity. And I participated, as Matt knows, because Mr. DeFerrante, I'm sorry, because we were both on the same team that was done out in the community, and it's just not the same doing it virtually as it is in person. And but it really was a great program, and I encourage the county to continue rolling out programs like that for staff because they're hard conversations to have, and they just are hard conversations. And I appreciated the opportunity to do it in a room with my supervisors and people that I work with every day. And so they know what I expect. And I got to hear a lot about, from them as well. So thank you.
Great. Thank you. Thank you to you, Deputy Kidwell, Deputy Tara Johnson, Deputy Barrett, and the entire team. A big thank you as well to you, Sheriff. Appreciate it. And we will each, I know, be following up, and I do hope we can actually see each other in person sooner than later. So thank you. Okay, Mr. Manager, I think next is Public Safety Communications and Emergency Management. Is that right?
That is correct. Somebody who you're very familiar with, Dr. Aaron Miller, will lead us in that presentation and introduce his staff.
Good afternoon, Mr. Chair and board members, Mr. Manager, thank you very much. Jeff Bergen, our Fiscal Affairs Officer, has brought up the presentation, and he'll be assisting me with the presentation today. We also have on the call today Will Flagler, who is responsible for our emergency management portfolio, Heather Geldart, who handles what we call integrated programs. And so that is our outreach, community engagement, IT functions, all those things that sort of blend across our department. And then Dave Mulholland, obviously our ECC administrator. So thank you to them for being with us today. So just briefly to start out with a review of our mission and goal. As you know, we have 2 lines of business within our department, as the name so plainly states. But at its core, both emergency management and 911 are about coordinating and integrating the activities necessary to build, sustain, and improve the capabilities for all hazards emergencies. In some, it's getting the right resources to the right place at the right time, and whether that is through our 911 system and in conjunction with our partners at the police department and fire department, or if that is in our emergency management function where we are really helping to coordinate and plan large-scale emergencies, planned events, and the like. Again, as I mentioned, two lines of business. One of the things that I always like to point out, and that you all know more so than anybody, is local government is the seat of accountability and performance. And this past year has shown us how important it is to have that unified, organized, and coordinated planned response, both to day-to-day emergencies. So whether that is the motor vehicle collision that's on the GW Parkway, or if it's a large-scale incident or the special event, the Marine Corps Marathon, those things that we normally see within the county. And that really is where our department shines, right? To provide that prompt, effective response, to bring those pieces together, to leverage them, the resources that they possess within their departments or agencies, to keep our residents and our community safe and healthy. Next slide, please. So just briefly, some budget highlights from our fiscal 22 budget that's been presented. Three core areas that we're focusing on. First is ongoing COVID response. Second is really the idea of regionalization. And third is continuing services. So on COVID response, the budget that has been presented and proposed to you is designed to support and continue our efforts to provide the unified, what I call the whole of government approach to combating COVID in Arlington County. You all know from our weekly briefings, work sessions, and others that it is a wide variety of local government partners that are bringing their forces to bear for our residents. Looking ahead, in particular, the natural and man-made threats will continue to create an environment where we foresee increasing costs of disasters and greater disruption. We saw that in the Houston weather event this past couple of weeks, right? Severe weather event, unheard of cold temperatures. Those wild weather swings are here to stay. And then today, FBI Director Wray testified on Capitol Hill about the dangers of domestic violent extremism and racially motivated violent extremists advocating white supremacy. He noted that the amount of angry, and this is a direct quote from his testimony today, the amount of angry, hateful, unspeakable, combative, even violent rhetoric on social media exceeds what anybody in their worst imagination could have thought. That is and remains a persistent and really, in my mind, existential threat. And so how do we continue to keep that frame in focus as we prepare for what comes next in our community? And that really is, for us, it creates layers for our planning, our engagement, and our posture. And so we have to, by nature, it's our job, we have to keep our head up and focused on what that environment looks like and what the National Capital Region threat picture looks like. Regionally, I like to say that Arlington County continues to punch above its weight class, and this budget will support that. And so whether that is the technological innovation and partnerships that we have to work across jurisdictions, or it is our work amongst regional partners. And I'll just highlight Chief Pavlitz last year was the chair of the Homeland Security Executive Committee's Advisory Council. I took over as chair this year. Obviously, I serve in a role on the Regional Emergency Support Function, the Emergency Managers Committee. Dave Mulholland is our chair of the Interoperable Communications and Public Safety Working Group. We've got representation on the Northern Virginia Emergency Managers Committee, the Northern Virginia Emergency Regional Response System. And so really, we find ourselves in a position to continue to lead on efforts of cross-jurisdictional importance, including 911 emergency management. And then the last really big bucket that this budget proposal supports is to continue the services and some of the key important items that we've identified in COVID that we want to bring forward. So whether that is remote work capabilities or transforming how we deliver training and engagement to the community. We've got our first entirely virtual community emergency response team training coming up. It is also going to be entirely in Spanish. And so, some of the assets that we've been able to develop, including the use of such virtual technology as Microsoft Teams, which hosts us today, it enables us to do these things. Next slide, please. So as I mentioned, there are a couple of things that really have changed fairly radically within 911 and emergency management been accelerated really by the pandemic. You know, that old aphorism of don't waste a crisis is absolutely true, right? If you can use the opportunity to provide better services to the community and do so in an increasingly sound way, then absolutely. So we've instituted and developed programs and equipment for remote call taking and remote dispatch. So this allows us to take the entirety of the force of technology of the 911 system and actually allows people to be able to take those calls and provide dispatching services from home. Between July of last year, July 29th to February 24th, we've got just about 1,430 total hours worked on our remote call taking systems. That's 6,900 non-emergency calls processed, 3,022 911 calls processed, for a total of just under 10,000 total calls processed. We continue to use the remote units for things like no notice call outs or pages, right? So when we see unanticipated surges, you know, we can put a page out and bring people to bear for that. When we've got folks who call in sick, we know that that's going to happen. This allows us to be able to add some flexibility to our workforce. Great benefit for them, and then helps us direct and target overtime where we can best support. And then the other thing is, you know, really the application and hiring process, which is, I think both the sheriff mentioned this and Chief Poblitz mentioned this. You know, remote technology, the critical exam, which is an exam for our hiring application, is now able to be administered in the cloud, so to speak, wherever you are. Previously, you had to come in. And then we're using the platform that HR uses called Spark Hire to be able to conduct our interviews virtually. All that means greater flexibility for the individuals who would want to apply for our jobs, right? I'll give you an example. You know, we've got a number of folks who, during the pandemic, simply weren't able to access the times for testing or interviews, and that would mean a higher dropout rate, higher rate of attrition from the application process. So this has been a wonderful advancement for us that we definitely want to keep around. Next slide. So another one, I want to talk about this briefly. We've got a little bit more of a slide on this, but the longest emergency to date in Arlington's history has been COVID, and the cross-departmental coordination has been key in building the processes that not only the public sees, so vaccine testing, rental assistance, you know, other housing and human services assistance, but also the behind-the-scenes operation that sustains all of that work. We really based our strategy in maximizing the benefit from every tax dollar that's been applied, what I've often called linking and leveraging, right? Finding those partners, finding that funding source, leveraging that to be able to deliver. And we really built on a solid foundation of our financial management and emergency procurement practices to be able to handle the demand. A couple statistics for you. Since 2000, Arlington County has received about $11.8 million in FEMA Category B public assistance. So this is our snowstorms. These are our severe storms, et cetera. That includes about $4.9 million in reimbursements that Arlington received for its work at the Pentagon following 9/11. COVID alone, this is just to date, from FEMA money, FEMA Category B, we're at $8.8 million. So we've almost surpassed the entirety of the last 20 years of Arlington's Category B public assistance in less than a year. And you know, this has been huge. As I mentioned, I got another slide about this, so I'll leave some more details till then. And then finally, sort of one of the things we want to pull forward that I don't want to neglect is this idea of leveraging our virtual operations. Since March 2020, we've been able to maintain our virtual emergency operations center, bringing that together in person when necessary for certain critical events in a physically distanced and safe manner, adhering to public health regulations. You know, we've really been able to absorb the planning for inauguration and election, and unplanned events while existing within this virtual framework. You heard Chief Pavlitz mention the idea of an incident within an incident, right? How every call had to be treated within the COVID context. Same thing for us, no different. The framework of COVID and then sort of the incident or event that we've been planning for and managing, all within that framework. Next slide, please. So you heard me mention that 8.8 million in FEMA reimbursement, but to date there's over $50 million in federal funds, and this $50 million only includes, it does not include some of the transit money that went to WMATA. So there are sort of, this is a lot more total federal assistance when you look at it. But this 50 million includes funding from DHS, from HHS, HRSA, the Department of Justice, Department of Labor, CDC, State of Virginia, and more that have gone to departments and agencies across Arlington County government. And, through our coordinated efforts, what we've been able to do is figure out where we can best match those funds to what the needs are to maximize our funding. And so you'll see some statistics that have been able to result from that. Over 2.5 million pieces of personal protective equipment for not only our healthcare providers, but other public health and healthcare providers that have been in the community. About 33,000 total tests that we in Arlington, quote, have conducted, and that is at our testing sites. Again, that represents only about 20% of the total tests conducted within Arlington County to date. And so, that's still a pretty large number. We're going to talk a little bit more about vaccines, but, these funds directly supported the ability to upstaff and purchase critical equipment and supplies for vaccine distribution. And we still have a lot of time left on the clock here. So I just wanted to highlight this and the great work that our teams have done to be able to maximize federal dollars for our community. Next slide. All of this really, I would say, has been done with a focus on equity. So you may remember discussions early on with COVID testing, right? How we utilize census data, community demographics to be able to create plans and operationalize that data to focus on those most impacted. And you're seeing us continue to do that. So a great example is our movement to more mobile testing in partnership with Quest that will be starting in the next week or so. That is going to allow us to spend 2 weeks out in the community at various sites, bringing lower barrier, no cost testing that we know the community continues to need in order to stay safe and healthy. Multilingual, multimodal pandemic support communications, and assisting with getting the word out about everything from testing to vaccine. One of the best practices that we are going to pull forward is an access and functional needs advisory group. This interdepartmental, interdisciplinary group will help advise us on best ways that we can ensure that our plans are as inclusive as possible. And that way, when we go into an emergency, that we have plans that are developed with a whole community mindset and approach. And then, as I mentioned, some of our specific targeted communications, things like CERT for the Spanish language community, recruiting materials, radio ads, video mailers, et cetera, in partnership with communications and public engagement. Next slide. So just brief budget summary. You do see that our budget, again, prioritizes the maintenance of core operations, programs, and staff. The primary drivers for us really is being able to pick up the phone and answer 911 calls, and then being able to sustain emergency operations. And so that is the proposal that's been presented before you. Next slide. So overview of the budget changes. We focused those on administrative changes and attempting to realize some efficiencies where we could, while maintaining the prioritization of those service areas. One of the notes you'll see is a transfer position to Human Resources Department. I'm a firm believer in sort of the cross-departmental or multidisciplinary approach to some of the struggles that we have. It's no secret, and I've talked to you about this many times, about our recruitment, retention, and hiring practices within 911. It is a struggle like it is in all of public safety. And so, to that end, to see if we can do things a little differently and see if we can come up with some good solutions to some of our problems. we've agreed to transfer a position to Human Resources to provide strategic HR support, really use the entirety of the weight of centralized HR to help us with some of those functions. And then the revenue decrease, just to note, you will see a little bit of revenue decrease that reflects a change in the agreement with Falls Church for the reimbursement of 911 services. Next slide. So the detailed budget reduction, the first one was a freeze of two of our emergency communication technicians positions. They're currently vacant. I have 7 vacancies right now for emergency communications technician. We do have a recruitment that is in process and have seen, thanks to the virtual capabilities, we've actually seen a higher number of applications and a higher throughput through all steps of the application process that we've previously seen. So we do feel that we're going to be able to bring some folks on here before the end of the fiscal year. But we, like anything, have natural attrition, retirements, and vacancies. And so we're going to look to freeze 2 of those positions. Next slide. The second budget reduction is really to do with overtime. You know, we have a number of categories of overtime, both in built in because of the way the schedule is structured and the nature of our operation, but also in what we call backfill. The police department and fire department provide invaluable partnership by training police officers and firefighter paramedics to actually dispatch with us in the 911 center. It brings in a level of expertise into the 911 center that is unparalleled. Many agencies you'll see don't accept that. I think it makes us stronger and frankly helps demystify some of the folks that are behind the headset, right? Instead of it just being the voice on the radio or the other end of your CAD terminal, it does provide us a wonderful glimpse. And also it helps our folks, you know, when they have questions about operations, they want to know certain details. It is invaluable and I greatly appreciate it. One of the things that we're doing to reduce our overtime is changing the way that we train and bring folks on board. So we're going to, a couple of folks that we have, we're going to be able to put them into dispatch first. And so that'll allow them to go to the floor and then take some load off our overtime. The other thing is this remote call taking is going to be really important to reducing some of our backfill overtime. And then we're working on a priority plan for our overtime, sort of how we structure it and how that goes out to make sure that we are staying metric based in our application of overtime, be really targeted with it. Next slide. So contract efficiencies, this is another one that I think is going to be interesting. You know, a couple of our contracts, we firmly believe that we can improve upon some of our, for instance, break fix, right? So we just installed a brand new call processing system in conjunction with Alexandria for our 911 call processing. We know we're going to see some contractual savings there, and we will not have a loss of service as a result of that. Our stuff is brand new. It has certain things that are still in warranty, and so we believe that we're going to be able to save some there. A couple of other things, we're sort of restructuring how we look at some of our contracts. So, for example, on our radios, our current radio contract includes an annual preventative maintenance for all of our subscriber units. What we're finding is that many times those units don't get in simply because, you know, the police officer or firefighter has to go off the road to take that radio to the shop. And so what we're doing is working to develop the cache of radios, put those in the process. It goes in for the PM. And we're seeing that prevents us from having to dip into the break fix. Some of those minor changes in how we operationalize them, we think are going to be able to save us a fairly significant amount of money this fiscal year. Next slide. You know, key in our mind and just things that we know are going to linger out there is a couple of our staff positions are supported through regional emergency management funding. 4 of our emergency planning and response personnel and 1 of our individuals that's involved in community engagement and volunteers and donations management. The grant environment continues to change and the funding environment continues to change. And so that is, you know, as we see potential reduction and realignment of those federal grant programs, there could be some staffing impacts. We don't know those yet. I'm very lucky in that the manager, I will say, is one of the most involved county executives in our Homeland Security Executive Committee at the Council of Governments. And so he is keenly aware and advocating for Arlington at every chance to make sure that we are aware of these impacts and can structure in such a way that it lessens whatever the impact would be to the community. The second is, I will say administrative call taking. 65% of our calls still continue to be, quote, non-emergency in matter. The standing up of 7999, I cannot tell you enough, and I know I provide these details, but the staff at the Department of Environmental Services, at Parks and Recreation, at libraries, at Human Services, all of the staff who make up those individuals who call take for 7999 have absorbed a huge burden that otherwise would have absolutely gone to the ECC and the non-emergent line. They're answering over 1,000 calls a day now on all things COVID, whether that's testing, whether that's connecting to resources, and now most recently vaccine. Post-pandemic, there's a level of service there, right, that is still may still be necessary, some way, shape, or form. We don't know what that's going to look like yet. And the ECC may have to absorb some of those calls as we continue to figure out structurally what our long-term plans are for those types of resources. And then the last thing is, there are some wonderful discussions happening with our regional partners in the same vein that we partnered with Alexandria for our 911 call processing. There are discussions about computer-aided dispatch as well as radio. And those partnerships create efficiencies. However, they come with upfront investment. As those discussions continue, they do have the ability to impact some of our budget decisions and departmental actions moving forward. With that, I will turn it back to you, Mr. Chair, and happy to answer any questions.
Thank you, Dr. Miller. Certainly, we may have questions. We have gotten to see you a lot this year, for sure. So, and we will be talking COVID vaccines in a few minutes. I know this is sort of a double header for you and for us, but I don't know if there are any questions. I think we probably all, through head nods and in one way or another, want to thank you for your leadership this past year through short beards and long beards, but also through days and days and so much work that, and also, busy year in general. So it's good to hear also about the call center work, which in addition to the 7999 number and all the COVID response, it's a ton on your plate. Ms. Crystal, question.
Thank you. I think the term crisis within a crisis describes a lot of our work over the last year and years, especially. So in a similar vein, actually, I did want to ask a little bit about some of the recommendations of the police practices group. Dispatchers, 911, really were a focus of near-term and medium-term recommendations. I'm thinking in particular of their call for public campaigns on the appropriate use of 911, and also this idea of trying to train and empower dispatchers to respond to calls maybe with more discretion than current protocols. So I'm interested to just ask, I know you all have received the recommendations in recent weeks, and again, crises upon crises. So understand if you're still evaluating and marinating it, but to the extent that you're thinking at all about these recommendations, I'd love to hear about it. And in particular, I'm thinking, especially watching your presentation today, how these kind of more innovative or forward-looking, or just frankly, kind of affirmative recommendations coexist with constraints on the call-taking process for non-emergency calls that you were just talking about in the budget. So kind of a couple of questions embedded there. But.
Sure. Yeah, no, thank you very much for that question. You're absolutely right. I had the opportunity and the pleasure to speak with the police practices group and one or two of the subcommittees on a number of occasions, and I know Dave Mulholland did as well. Their recommendation does include, in this budget proposal, include $65,000 specifically for work in the ECC, and I've sort of been discussing this both with the manager and with some of my colleagues and those across the country. I think there's a couple of different things to highlight. One is, you were right, some degree of public campaign as to when to call, what 911 is useful for, and what is appropriate, not appropriate. The idea of implicit bias training for our 911 operators, I think, is a good concept. But when I ask my colleagues and look at evidence-based research as to what makes changes and what, I ask myself, what is the problem we're trying to tackle, right? And the tackle there is, it's a systemic problem, right? Our call takers are only as good as the information they receive. And so if someone is going to call and say X or Y, teaching them how to ask better questions is one thing. But I think more importantly are some of the things that you all have discussed are the dialogues within the community that help us identify our own cultural, systemic, and implicit racial biases, and have honest conversations about those. And things like alternative conflict resolution within neighborhoods, right? All of this goes together, I think, and is a part of how we can be better in 911. I don't think any one of them exists in a vacuum. So we are looking at it. We're, asking, as I said, for best practices across the country to figure out what we can do. And then obviously committed to working with the police department as they implement changes to, for instance, protocols or new programs in conjunction with human services for co-responder models and things like that. We're happy to support them, looking forward to it. So I hope I touched on all of it.
You did, thank you. And I think, I know the alternative dispute resolution group had really sort of talked about this idea, which I imagine is also challenging, about how the call takers could have more discretion. But I think maybe you spoke to that a little bit in terms of empowering them to ask those follow-up questions and helping them understand what the follow-up questions may be to garner more information. So that's exciting. And then it sounds like the idea of the public information campaign maybe resonates with you all as well. And so I think that can be something that we can look forward to exploring perhaps more of in the year ahead. Thank you. I appreciate it.
Thank you, Ms. Crystal. Ms. Garvey. I think you're on mute. Sorry.
No, you don't have to be sorry. Thank you. I think Mr. Carantonis had his hand up or before I did. But maybe it's down again. I don't want to.
Down again.
Okay. Go for it.
Let's cover what
I'll go for it. Sorry. So I want to follow up a little bit. I was realizing, are you thinking that after the pandemic that we might keep the 7999 number for other uses that will keep people from calling the emergency number? And I'm thinking this particular issue when somebody's nervous, and they think they call 911, but if they had another number to call, rather than tell them don't call this number, but you give them something else to call, that might be helpful. I don't know if you've been thinking about that or not. Do you see what I'm saying? You give some people something to do. Don't tell them it's this or nothing.
Yeah, no, I do. I've really been looking at it in the context of what our COVID response will continue to be. It is no secret that the lingering effects of this on our local economy, on small businesses, on food, housing, stability, as well as medical care is going to be, it's going to have a long tail. We just don't know. And there is a potential that we will need to be continuing to administer some type or some level of vaccine. So I've really been focused on it in the context of COVID and thinking, that demand I don't see going away anytime soon. I mean, they're now talking a little bit about booster shots like you do your normal flu shot, right? I mean, that burden of being able to answer questions to the public is not going to go away. I try to keep us both concentrating on what our sort of here and now battle is, but thinking about those things longer term. Beyond that, I think, we had a wonderful bit of work that coordinated intake into the county for a wide variety of issues that the communications and public engagement team led. And I think COVID has changed some of that work and changed some of our assumptions. We do need absolutely to look at how folks access us, and I say us within the county, through any door and window, right? that they can get into, because there are quite a lot.
Great, thank you. And I am remembering, I think a year ago, we were just talking about whether we should do a tabletop on a health emergency. I think you overdid it, just saying, but great job. Thank you.
Thank you, Ms. Garvey. And we'll go to Mr. Karantonis. We're now just keeping in mind we don't have for too long in the COVID time period. We're trying to keep that conversation focused. But I'm not trying to prevent you from asking a question, Mr. Karantonis. Just wanted to.
It's a very short question. It's very, very budget, attached to budget rather to policy. So there was a position for a resilience, community resiliency advocate last year. So is that still? Does this position still exist? Is there a role for this position? I'm just trying to figure out. And thank you for the comment on how accessible you are. I noticed and I believe many Arlingtonians noticed the cert in Spanish, etc. So that's important.
Good. Thank you for the question. Yes. So what that position last year did was increase our community engagement team, really to round it out. That functional team now, through restructuring, has 3 people on it, led by our communications and public engagement lead, which is Hannah Winnant. Our second on that team is we have Samantha Brand, who really fills that position and helps round out our portfolio. And then we brought on Lucia Cortez, actually, for our volunteer donation management position. And so, yes, what our goal is to be able to provide not only programming, but also information and accessibility in I would say, much more widely available and, I guess, digestible is the word that I would use for this setting. Stuff that we put out in emergency management can be it's wonky, right? I mean, I can tell all you that. You know that. It's the message can be complicated. And we've got to figure out a way to meet people where they're at, right? To make it a little bit more easy to understand, a little bit more digestible, and a little bit easier to figure out how they can take action to keep themselves safe, both in an immediate instance, but also longer term with some of the threats we face.
Thank you. I couldn't commend you more to the amazing team you put together. Thanks.
I think Mr. Karantonis said it well for all of us, really. You've been working hard and well, and we are thinking of those who are contributing to your 7999 effort, which is a real challenge. So thank you. We will see you in a bit, I believe. So thanks very much for the presentation. Back to you, Mr. Manager, for our final public safety. Go ahead.
Yeah, thank you. Not going to waste any time. Over to our acting chief, Andy Penn, with the police presentation. Andy?
Good afternoon. How is everybody?
Doing well. Thank you.
So I'll start with introductions. Who's with me? I'm joined by Deputy Chiefs Quigley, Dunn, and Murray. And we're also joined by our budget analyst, Amy Costanzo, who masterfully manages our budget. So I realize we're short on time. I will get straight into it with some conversations about accomplishments from this year. It's been said many times, but there's no question that COVID has made this an incredibly difficult year for everyone. And in addition, the past year has been particularly challenging for law enforcement across the U.S. and here in Arlington. It's important for me to say that I'm incredibly proud of the men and women who make up our police department and appreciate the work that they do every day to ensure the safety of our community. Moving to some of the highlights, I'll start with the police practices groups and legislative change that's on your screen. We were involved clearly at every step of the way with the police practices group, membership on each subcommittee, but we also back in the spring started our own groups within the police department in a number of different areas to make sure that we were looking introspectively to find ways that or areas that we think we should change, areas where we may improve. And those groups have worked at the command staff level involving the rest of the agency throughout the summer and fall. And we're in a place now where once we get the final piece of the police practice group, one of the things we're going to do is sit with all of this information, as the leadership of the police department and identify areas that for change or areas where we can grow or do things differently. So there's a lot happened on that throughout the year. In addition, there's been a lot of legislation that's required, so a significant amount of policy change and adaptations to some of our workflows. That leads me into the e-summons program, which, this has been in the works for several years. And I'm very happy to say that later part of this week, we're actually going to go live with that with a small work group. And hopefully over the next week and a half or so, we will be fully deployed across the entire police department. And this is a big accomplishment because we're going to have the broadest e-summons program across the Commonwealth. It's been delayed several times by compatibility issues between the systems. Printers didn't work, but we feel as though we're in a place now where the system is ready and we're going to begin deploying tomorrow. One of the unique things about e-summons and the legislation that came out to, track demographics of people who are stopped for traffic or individuals who are stopped by police, we have incorporated that into our e-summons system. So all of the data, the demographic data that's required by the law is actually going to be captured through this system, which is much more conducive to, year-end analysis by work group, by agency, by individual. It's really going to give us the ability to have everything in one place, and we're expanding it beyond what was just required by the state. We're going to capture, did we ask somebody to search? Did we search? Did we find anything? So adding several more components to allow us to have the ability to, when we do audits, have a meaningful look, in the aggregate and down to smaller work groups or individual employees. So I think that's a unique feature of our e-summons program, but I am very happy that that's rolling out finally. As you're aware, throughout the last several months, we have fully implemented a body-worn camera program. This rollout went incredibly well for a program of its size to be able to get all these cameras out, have the policy, have the community weigh in on our policy, and also to change over all of our cars. It was a big undertaking, but I think it went very well, and we're all very happy with how the program is working currently. It's been mentioned before by the sheriff, but I think I should touch on the critical incident response team. I think everybody's aware of what this is, but a very short synopsis is it's a regional agreement amongst Northern Virginia to where any serious use of police force, to include a police-involved shooting, the chief of that agency has the ability to activate this team, which will be experienced investigators from every participating agency will come together, absent investigators from the jurisdiction where it occurred, and that body will do the criminal investigation into the shooting and ultimately report their findings to the Commonwealth's attorney for the involved jurisdiction for that person to make their independent judgment as to is the shooting good or are there criminal charges that are appropriate. This is a big change. It's important, for transparency. It's important to us that people have confidence in the investigations that are done. And I think this brings an added layer of transparency and hopefully trust as we move into this. We signed the MOU a month and a half ago to make it an actual real thing now. And the team is actively working on creating policies and procedures. So hopefully within the next couple of months, it will actually be ready, up and running and ready to go. On the screen, you'll see a picture of FR Canine Brooks. Brooks came to us through an MOU from FR Canine. Brooks is a therapy dog. And, I'm going to talk about wellness later, but Brooks has brought an inordinate amount of smiles, both online. He's very popular online, but he also roams the police department and spends time with people. Brooks has been down with our peer support team to the United States Capitol following January 6th to provide comfort there as well. And he's a positive addition to our peer support team. It's important that I mention Brooks. The bottom part is the Homeless Outreach Program. This is a multi-agency effort to help identify unsheltered individuals and connect them with resources and services. The police department clearly participate in partnership with DHS and several other agencies such as ASPAN, Veterans Affairs, Bridges to Independence, and several others, go out and try to identify people who need resources, who need some level of care, and hook them up with that service. It's been in effect throughout the last year. And throughout this time, there's been over 400 field contacts made, 200 meals distributed. This team assisted with placing 30 high-risk people in the Highlander in Days Inn when they were in most need of it. The team has deployed Narcan on 2 different occasions when somebody was suffering from an overdose. And one of the programs that got a lot of attention was a hygiene and PPE backpack program. This was a grassroots type program where officers and several of their friends gathered a lot of different hygiene things, PPE things. A lot of things were donated, and staff went out and has given those to unsheltered people that were in need of them. So I think this is a very positive program that's moving in a very good direction, and it's new throughout last year. So I just wanted to bring that to your attention. Next slide. It didn't change. It did. So throughout the year, we worked really diligently to identify means to remain fully operational despite COVID and continue providing all levels of police service throughout the pandemic. We asked an incredible amount of our staff to rapidly change to the pandemic concerns and are certainly very appreciative of the flexibility of all staff members and their determination to continue to provide all police services throughout this unique period in our history. Some of the additional challenges that we faced or actions we took during COVID, our officers spent a lot of time directing traffic, providing security at COVID sample collection sites, security around PPE stockpiles, around vaccine. We had to make several changes, as did everyone in our daily operations. Most of our roll calls were switched to Teams environments instead of in person. We created a system where we could divert additional non-emergency police calls to avoid face-to-face contact and reduce exposure. We increased telework where we could. I mean, a lot of our staff can't telework, but we did expand that in any areas of the department that we could. Additional cleaning of police vehicles, adjusting our administrative service hours to reduce interactions, suspending the ride-along program. And we also expanded our online reporting to include crashes and a system that allows for reporting in Spanish. So a lot of changes to make sure we were adaptable to the pandemic that I think have all gone very well, several of which we intend to carry on to the next year. This slide highlights the overall reduction in the expenses by $883,000 approximately, with an increase of revenue in 661. The increase is primarily due to the expansion of the Photo Red program, but I would also note that the increase in revenue is almost entirely offset by the additional expenses associated with expanding the program. And while there's some additional staff positions and reductions in staff positions, so an overall net minus 7.6 full-time employee positions. So first, about the Photo Red program, we're looking at adding 5 additional intersections throughout the county. Our current vendor will study the intersections that we suggest to determine if they meet the criteria outlined by the state code. We're assuming that several intersections will meet the required standards and we'll be able to expand this program. And the additional funding is to cover the monthly service fees associated with that program. As I'm sure you're aware, last year the Virginia legislature approved electronic speed enforcement. So we're also working through the procurement process to obtain a vendor for this program as well. Ultimately, our goal is to incorporate Photo Red, speed, and our electronic parking ticket system into one vendor, but that may take a little bit of time. I would note that this expansion of Photo Red is in line with the PPG recommendations. And one of the other challenges that may come at some point is we have one position that does all of our photo ticketing. So as we continue to add to the program, there could be a need to add another position to help with that. But at this point, one person's been able to stay on top of that program. The next addition is the increase of the creation of traffic safety officer positions. The proposal is to add 6 new traffic safety officer positions. These employees would conduct all duties of our current public service aides with several additions, such as directing traffic, deploying and maintaining our electronic messaging and speed measuring devices, coordinating maintenance replace of equipment, and assisting with multimodal transportation safety efforts through education. We're putting a lot onto that group, but I think that's going to be a positive addition to our overall transportation safety efforts. So first, excuse me. I'm trying to get through it quick. I know we're on a time schedule. For our overall reductions, the first is operating supplies. In this area, we just look for efficiencies, and proposed is for $127,000 reduction. We feel like these efficiencies could require us to have to, we'll have to buy some less supplies, some things like range supplies, office supplies, paper may have to be delayed, but this looked like a place we could find some efficiency for the budget challenges. Next is fuel. We're basing this proposed reduction on the current cost of fuel, or the cost of fuel a couple of weeks ago, and the fact that we're utilizing several more fuel efficiencies. The 227,000 reduction is significant. So if gas prices change substantially, this could be problematic at some point in the fiscal year. Next reduction is 2 public service aid positions. Both of these positions are currently vacant. The impact, obviously, of reducing our public service aid staff is a potential loss of parking enforcement. Each public service aid issues about 5,600 parking tickets a year. And we get a lot of calls for parking. Parking is a challenge at times. So we feel like this reduction will certainly have an impact, but our hope is that the addition of the traffic safety officers will offset this reduction and leave us in still a good place. Another reduction of a fingerprint specialist 3. Again, this position is vacant and has been vacant for some time. The impact of freezing this position is basically we have to spread the workload out amongst the remaining 4 fingerprint specialists, which we've been doing for some time because we haven't been able to fill the position. The next reduction is crossing guard hours, and these are hours above and beyond the current accounting for crossing guards we had last year. So the number we had last year has not changed. This is an additional allotment of hours that have not been filled in some time. So it's not going to impact where we were last year. And, keeping crossing guard positions filled is always a challenge, but we have developed a system where we evaluate proposed crossings based on a host of different traffic criteria to make sure that we can prioritize where we do deploy the resources that we have. The next reduction is a reduction in a freezing of 10 sworn police officer positions. Over the past couple of years, we have consistently been somewhere between 18 and 20 police officers short. Our lower staff numbers force us to rely on overtime to meet minimum staffing and deploy extra details, which has always caused us to go over in our overtime budget annually. The funding for these positions is what helps offset the overage and the added overtime expense. We don't anticipate this reduction would require substantive change in the structure of the police department, but it will require us to restrict a lot of overtime details to make sure that we can operate within our overtime available money. Some of the unfunded details that have to be monitored or cut would be like the county roving work detail, some of the work at the COVID sites. I'm not saying these would be, these are just examples. Anything that's unfunded would be a challenge for us, particularly as we move throughout the year. We'll also be trying to stay within our funded amount on several of the other details. This is traffic safety programs, the nightlife detail. So, in all, this really is going to amount to, we're really going to have to be tighter on how we spend overtime throughout the next year. If we find ourselves in a challenge, we may have to reallocate some staff back to patrol to help us maintain minimum staffing if that becomes too challenging as we move throughout the year. Some key budget considerations. One of the most significant challenges that we have right now is recruitment and retention, which ties directly to pay and compensation. When I speak with the officers, this is one of the concerns that comes up most frequently. And this certainly impacts us in both recruiting new officers and keeping the ones that we have. I mentioned before the tough year it's been for law enforcement, and we need to continue attracting and retaining the best candidates. And we've worked really hard to make sure that we bring the best candidates to Arlington that are going to provide the highest quality of service for this community, and we have not reduced our standards. So pay and comp continues to stand at the center of this conversation, and it does present a challenge if we head into a second year without pay raises. So I'm going to talk about recruitment in the next slide. So I want to move on to preparedness and training. You know, given our location in the National Capital Region, the businesses that are in and coming to Arlington and the challenges we face, it's critical that we have an emphasis on preparation and training. After 9/11, we created a tactical training unit to make sure that our officers were equipped and trained to handle anything that came our way. Now we're exploring the expansion of our training unit to incorporate training that's non-tactical in nature, skills such as de-escalation, cultural diversity, bias training. Again, this is in line with the PPG recommendations, but this is something we're just starting to look at as a staff demand, but it's something we will continue to explore as we go through the coming months. I already talked about emerging technology, the body-worn camera program. While I think it went incredibly well, the rollout, we always find little things where we need to make some tweaks, and we're working through that piece now. And e-summons was the other major technology piece, which I think I've already covered. One of the challenges we expect to, as we come out of COVID and move through the coming months, continues to focus around nightlife. The Ballston and Crystal City neighborhood have seen an increase in nightlife, and what used to be called just the Clarendon detail is just now the nightlife detail to make sure that we're expanding to cover all the different parts of the county that need service. I know you're aware of ARI. I think this has been an incredibly beneficial and successful program. Throughout the last year, we now have 47 restaurants accredited. In the last year, in conjunction with the bar staff, 212 fake IDs were collected, 23 security staff members were trained, 80 true restaurant staff members were trained, and 39 officers, deputies, and fire marshals have been trained on best practices. This is definitely a program that we will continue to focus on as we move through the coming months. So for recruitment and retention, you know, we currently have 22 vacancies. The challenge for us becomes anybody who's in a training status or a long-term light duty status doesn't count as a functional body at that time. So while we have 353 sworn officers currently on the books, you know, functionally we are substantially lower than that. And that's what was the predicate for when we restructured in 2018. You know, we continue to have a lot of success in recruiting, but we do have several members who have taken advantage of the early retirement options, people who have just left. In FY20, we had 40 departures and we're only able to hire 24 during that time frame. Our recruiting staff has done an extraordinary job, particularly during COVID. Every part of the process has had to be changed to be COVID compliant. And throughout every part of the way, they found a way to make it work. We never stopped recruiting. We never stopped hiring. And, you know, this has led to the class that we just put in the academy in January is now 23 new officers, which is one of the largest classes that we've ever had as an agency. Our staff continue to really work to recruit diverse candidates who are reflective of this community, as shown on your screen. One thing that's not there, since 2018, in looking at our hires, you know, we're hiring diverse candidates at a higher rate than even our agency currently exists at. So overall, I see that there's great success in the recruiting work that's being done. You know, we'd love to say we can be full strength, but it's just not that easy to hire police officers right now. A few of the programs I think are noteworthy to mention. We've relied heavily on a program called Handshake since we entered the pandemic. This is basically LinkedIn for college students. And, you know, the student goes in, creates their profile, and with a click of a few buttons, we can reach out to thousands of students at one time. We can specifically outreach to HBCU universities. And the program gives us analytics to show how many people are opening their emails, how many people do we hire from that. You know, one example is we sent 30,220 students at HBCU universities, an informational email, 21% opened it, and it resulted in 82 applicants. I think that program shows great success, and it's allowed us to continue to be successful during the pandemic. We've also had a social media platform that we can focus around certain areas when we were going out and recruiting. That's really shown a significant increase in our web traffic, actually 200% increase in our web traffic. And the backbone of our recruiting program has always been our ambassador program, where staff who are from go to their alma mater and create long-standing relationships. And it's not a one-touch recruitment. It's a 1 or 2 year recruitment where, you know, we become a presence in classrooms. We Zoom in and teach classes. This has really been incredibly beneficial in helping us continue to recruit new officers to the agency. Next, please. So looking at some of the challenges, I'm sure everybody's aware we've had several increases in some crime across the county throughout the last year. Overall, for 2021, our preliminary numbers suggest that crime will remain relatively flat, which, you know, it's also important to highlight that crime is at, you know, historic lows. It's like as low as it's been since the Uniform Crime Report is starting. You know, the things that are of noteworthy is crimes against persons are up by 9% about. These numbers will change as we close our year in a few weeks, so there still may fluctuate some. But we felt it was important just to touch on some of these categories. Assaults is one of the categories that's going to be substantially up. In the aggravated assault category, this increase appears to be primarily due to having more weapons involved in these assaults. And in the simple assault category, these appear to be more domestic or family related, where we're seeing the increases. I mentioned use of weapons in the aggravated assault. One thing that stands out is the number of firearms seized. In 2020, we seized 102 different firearms compared to 93 in 2019. And in 2021, we're already up to 24 as of a couple of weeks ago. You know, that's certainly a disturbing trend where there's a lot more firearms that the officers are encountering. I'm sure everybody's aware of the increase in carjacking. This has been experienced across the entire region. Of the 16 that have been reported in Arlington, 8 have been solved with either an arrest or the person responsible being arrested in a different jurisdiction. And I can assure you, we work very collaboratively with the entire region on crimes like this. And we have had a significant deployment of additional resources in the areas where these incidents have been occurring, some visible, some not visible. But it's definitely something we continue to focus a lot of our effort on. The last category I would mention for increases are motor vehicle thefts. They're up about 40% compared to last year. And to put context of that, it's approximately 100 vehicles additional stolen throughout the county in the last year. Many of these are idling vehicles left unattended or vehicles with the keys left inside. So my quick public service for whoever's watching, please take your keys out of your car. And I get it, even when it's cold, please don't leave your car unattended and running. We've had a lot of cars taken in that manner. And unfortunately, we've also had several cars that have been taken in that manner that are used in violent crimes in other jurisdictions. The good news here is crimes against society, narcotics are down 17%, and property crimes are relatively equal. So overall, we're expecting a reasonably flat year, but we thought it important to highlight some of the concerns. As we move into the next year, employee wellness will continue to be a primary concern of ours. As several of the other chiefs have mentioned, you know, public safety has partnered to really focus on this together to make sure that we're providing the resources that our staff need throughout the year in a host of different mechanisms. The manager allowed us to get an extra position who's really going to focus on employee wellness in the public safety community. This has been incredibly important, is really going to make a positive difference. Some of the studies that have been done as of late across the Commonwealth showed that 71% of first responders report anxiety, 67% with sleep, 41% reporting depression issues. So it's important that we continue to make sure we're looking after those in the first responder program, make sure they have the resources that they need. I mentioned FR Canine Brooks, our peer support team has become much more active, and they actually have been accredited throughout the last year. And public safety collaborated with the Virginia Hospital Center and county HR. The hospital has developed a first responder centric program, which allows for first responders to reach out to the hospital and get into their services anytime they need. And this has been used several times. It's been incredibly beneficial. Next concern and challenge is the opioid crisis. This continues to be a very chronic long-term problem facing the county as well as the United States. In 2020, our overdoses reached an all-time high. So we're not seeing the decline we had hoped. You know, we will continue the education programs. Some of the things that I think are noteworthy is officers have been able to deploy Narcan 25 different times throughout the year. And the drug take-back boxes that are located throughout the community, there's been over 2,000 pounds of unused and unwanted medications collected in that. You know, this is the start. We have to continue to push education. We have to continue to have this conversation. One of the things that we've done is we've been very actively investigating overdoses to try to find out where the person got the drugs. And we're going after that person who's selling drugs, where somebody's ending up in a often life-threatening situation. The next slide, the picture on the screen just shows the concentration of calls throughout 2020. I think the point we're looking at here is, as we look forward, you know, as we come out of COVID, the commercial areas where you see the most of our activity is, you know, we expect those to repopulate. We're having added businesses come, which are going to increase that, which really leaves us in a situation where we have to look at our deployment of resources, because in order to be effective in community engagement, traffic, transportation safety, and crime control, the officers working in those areas have to have unobligated time to get out and meet with the community and do their job. So, you know, you can see in those areas they're incredibly busy, but an acceptable answer to that is not to pull officers from areas where it may not be as busy. So one of the things as we head into 2021 is to look at our deployment. Are there different efficiencies we can do, maybe changing our beat structure or going more to a zone policing? But this is definitely an area that we need to spend some time and find a way to make sure that we can meet the needs of the entire community, recognizing that there are certain areas where there's just an increase in the number of hours spent by law enforcement. And my final slide is on equity. You know, it's important to us to continue to develop and implement strategies to build trust. You know, everything that we do is based on trust. It's important that we have the trust of the community. And I believe how we get there is through transparency, accountability, and conversation. The work that the PPG has done and that we've done internally informs us on how we think we move forward. But I think it's important that we continue to have these conversations with the entirety of the Arlington community. You know, in this slide, what we're focusing on is there are parts of the community that we need to work to get more robust dialogue, where we need to get to build that relationship and not just rely on, you know, civic association meetings or community meetings. So, you know, it's important that we really have this touch with the entire community, and we are committed to doing that as we move throughout the rest of the year. Additionally, we have Lieutenant Chavez in the police department actively participated in the GARE training through the county, and she's put together a really good presentation that we as a command staff sat and did several months ago. And this is something we intend to move towards the rest of the agency to open this conversation so we can all have open and honest conversation. The last thing I would mention is that we have actively and will continue to participate in the Restorative Arlington Work Group. We've had officers assigned to that throughout the program, and we will continue to do so. I'm sorry I was rushed, but I was trying to be efficient with time. I'm happy to answer any questions.
Thank you, Acting Chief Penn. Really appreciate it, and mindful that this is important. So don't want you to have been too rushed. Let's get to questions. I know there's an ongoing police practices group implementation, but start with Mr. Dorsey.
Thank you, Mr. Chair and Acting Chief Penn. I'm just going to surface these for future follow-up, given our time constraints. So the first question, very sort of basic, on pages 345 and 358 of the budget document, there are tables about our arrests based on Group A and Group B crimes. And I'm having a hard time figuring out how the data presented on those separate pages, which seem to be covering the same information, how they relate to each other. The numbers just don't work for me. So if I could get a follow-up tutorial, I'd appreciate it.
Sure.
The second question, when it comes to criminal investigations, do we have any benchmarks for clearance rates? It varies in the 50s, 60s overall in the aggregate. So do we have any benchmarks for where we would like that to be or where high-performing agencies should be? And then the second part of that is, do we have those benchmarks or ideas disaggregated for the particular types of crimes so that we don't look at the overall, but we look at each discrete set? It looks like drug crimes, we have a fairly high success rate. I'm wondering what impact that has with sexual assaults, for example, and some of the other Group A crimes. And I'll just say, I'll leave the other questions. I'll follow up in writing. I do appreciate and want to commend you on how you've addressed engagement with the police department within the context of equity by thoughtfully thinking about the problem and then applying the 4 questions. That was really well done. I didn't want to let it be known that that was not observed. Thank you.
Sure.
Thank you, Mr. Dorsey. I believe it was Ms. Crystal next. Go ahead.
Thank you. I'm going to see if I can't follow Mr. Dorsey's lead and surface 2 things for follow-up, and happy to put in writing too. So Chief Penn, you and your team don't have to take frantic notes. But wanted to ask a little bit about red light cameras. I would never call something that can be as loathed as red light cameras a win-win, but it does seem like at a time when staffing is a challenge, and maybe also per the recommendations of the police practices group, we're trying to reduce the number of interactions that people, especially those not committing crimes against people, have with officers. It seemed worth pursuing, and I know the PBG had recommended, we'd probably need to follow up with the state legislature for increased ability to expand our authority for red light cameras. But I think we have the authority to put speed cameras in school zones right now, which actually covers a fair part of the county, and also maybe parts of the county where people are kind of most clamoring for police detail. So I wondered if that could be something we could even just start to surface in this budget, if there's potential for a one-time investment that could help alleviate some of the concerns on staffing, as well as get a head start on that ability before we continue to advocate with the General Assembly. The other question, we actually just today, I think, got from our county auditor a follow-up on report on the ACPD overtime audit from fiscal year 2019. A lot of those recommendations were about administrative and kind of operational controls of things like work assignments and invoicing. I wanted to take the opportunity to just commend you all for embracing and fully implementing nearly everything that came out of there. And I know, at a time when you guys have had a lot on your plates, that's really impressive. So I would be interested, and again, this could be, in writing and follow-up, whether the department's seen any improvements either just in, kind of the management of overtime costs, or the burden on staff of significant overtime, which I think Chief Penn, you described really compellingly as a result of implementing those recommendations. So I don't know if you have top-line thoughts now, and follow-up is great too.
I do have some thoughts on the photo speed. That's definitely something we're looking into. We just have to get a contract. So I don't even begin to know what the expense of that would be yet. So that's something that we're working on to try to get a contract.
Great.
So we're in the process of that now, and definitely are trying to push that forward. Regarding the efficiencies from the audit, I would like, everything is so different in COVID. I mean, our overtime is entirely different. We're not really having special events. I mean, do I think there's been value in the changes? 100%. I think it has brought more accountability, more involvement, making sure that management's involved in the conversation and aware of what's going on. So I do think that there are easy, no question, positive things that came out of that. For a statistical analysis, I mean, this year I think is almost impossible to do that because everything is different.
Yeah. There's no pre-post when it's just a huge shock of COVID.
There's pre, but post is a mess.
Yeah. Well, thank you.
Sure.
Thank you, Ms. Crystal. Mr. Karantonis. I think you're on mute.
Thank you, Thank you, Mr. Chair, and thank you, Chief, for the presentation. I understand that we are also under pressure. I can commend you on many improvements. I think that your department is still fairly digesting the PPG recommendations. We are doing that too, so we will have more conversations on that. One thing I wanted to put on your notes for later conversation is the issue of the school resource officers unit. I understand that there is no direct budget implication for that, but there is a functional implication in case that our colleagues over in the IPS decide that they want to modify this program. So I've seen that there are still, that you count with the continuation of the program, and I wanted your opinion on what the plus and minuses are for that. Also thinking about the other, of lack of personnel in other places within the department. The second thing is, following up just a little bit on Ms. Crystal's comment on red light or enforcement, automatic enforcement, red light and speeding. Whether there is or not a community input on what zone should be targeted first, especially when we think about school zones, that would be for me very of interest. So, and with that, I leave it for now.
Thank you, Mr. Karantonis. Ms. Garvey.
Oh, thank you very much. So no need to apologize, Acting Chief Penn, because we're the ones who, you've been admirable in how quickly you've got through this. I too will sort of just highlight a couple of things maybe for the future. Mr. Dorsey and I spent some time, it was a half-hour meeting with people down in 22202 about, carjackings and what's going on in their neighborhood. 4 of your officers joined us, and that half-hour meeting went for 90 minutes. And it was really, I thought, really good. I was so impressed with the officers and the interaction really with everybody. And we talked a bit about community policing. So what I'd be interested in, not now, but eventually, is maybe what would be the optimal number of police officers we ought to have to be able to do good community policing. I think we do a pretty good job with what we've got, but I'd like to know what you think we need to really do it the way we would like to do it. And that just involves this interaction with people when it's not something difficult, whatever. It's the building trust and getting to know folks. So I imagine that's the number of police officers. I imagine it's what we need to do on attraction and retention. I'm worried about the 10 police officers we're just freezing. So, I would open that, not that we can maybe necessarily afford it, but I would like to know what it would take in your estimation. And then just a big thank you to you for being our acting chief right now. This is a tough time to be a police officer. It's a really tough time to be a police chief. Oh my, did you jump into the deep end of the pool or gotten right in the middle of the fire? Thank you very much, and appreciate all the good work. And finally, I noticed the same thing, those answers to the equity questions. That was spot on. It was good. Thank you. Thanks much.
Thank you, Ms. So, sorry. Thank you, Ms. Garvey. Didn't mean to interrupt Acting Chief Penn. So first, just to thank you on the search team, the critical incident response. Love seeing that. Really appreciate it. And then I guess for brevity, I will mention that I think we're all thinking of the safety of officers. I know that our whole community, but safety of all officers with respect to vaccinations. I'll want to do some follow-up to just understand some of the details of our policies with respect to immigration, because I do think that you have been working and we have been working on this for some time. So I'll follow up with the details there and the balance of freezing the positions and also sort of seeking to have enough value for officers so that overtime will come down is another area that I just like to follow up. But very grateful. There's, of course, all the work of the police practices group is sort of right in our minds as we're also thinking this through. Wanted to give you just a moment if you have any closing thoughts, but very appreciative. It is not an easy time, and mindful that that the details are not always simple, and it's not an easy job. But also we've seen significant change with body-worn cameras. That is probably changing the job somewhat significantly. So any closing thoughts?
No, I appreciate you taking the time. We're happy to follow up on all these different questions. Like I had mentioned, I mean, it all comes down to trust in the conversation. So the more that we can all work together and have the conversation, you know, I think that's what's needed. That's how we move forward. And I think, you know, at the end of the conversation, the work, ACPD will continue to just get stronger and stronger.
Great, thank you. On that, we'll close it. Thank you, Acting Chief Penn and Mr. Manager and colleagues. As we go on, I want to be mindful. I'll be transparent that we are seeking to focus the conversation through 7:30 to help our leaders. And so, if folks need a 5-minute break, we could do it. But I'm also want to keep the time. Shall we? I wonder the will. 5.
I need 5, but please, I need this.
There's no reason. We'll take 5. We'll come back at before 6:25 if we can, and we'll keep the questions focused for Dr. Miller and Dr. Varghese and our manager. Thank you.
So we're taking more like 8, right?
Perfect. That's right. See you. Same channel. I think. Yes, same channel in 8 minutes. Thank you.
No, not same channel.
Oh, different? Okay.
Different channel.
Okay, different meeting? Okay,
Yes.
We'll go to that. Thank you.